Hi everyone, very good evening guys. I hope I'm audible and visible to all of you, and welcome to this 100 essential one-liner session. Today is of course the day for pathology, but this is a series which is going on for the 8 most important subjects, so you can watch out for all those sessions over YouTube live in the next few days. But from my side, we will have another session on microbiology on June 5th at 5 p.m. again. So that will wrap up the 2 subjects that I teach. So 100 each for each subject is how I've planned it. Although I've not kept a very strict count of these 100 one-liners, it's not that I cannot teach you more than that. Eventually, as you will get the PDF after the session is over, you will see it has many more than 100, but it's just that it's named so, but I cannot put the subject into just 100 one-liners. It's not possible. So now before the PDF gang comes our way and everyone would be worried about the most important question, you will get the annotated PDF after the session. Don't wait for the unannotated PDF. Reason being that to make this session shorter and to make it faster, I have already written in my own handwriting all the answers. So there is no unannotated PDF. It is all annotated already, and we will be writing a few points as whatever answers that you keep giving me. So first, PDF gang, I hope you are satisfied. You will get the PDF. Second question, of course, which we are asked all the time, is this enough? I would be very foolish if I say that, oh, just do one-liners and go and you'll pass the exam. It is not enough. Of course, your mainstay will be rapid revision for NEET PG students who are very close to their exam. Of course, now you have come down to the LRR, and then after that, this is the one-liner. So that's an entire combo that you have to go ahead. Depending on kitna time hai. For FMG students, you still have time. So you still stick to RR. In the last 2 weeks, you come down to LRR. In the last 5-10 days, you come down to one-liners. So that's how you keep going in a descending order. Also, we've got a couple of NEET PG students who have joined in. So they would ask me that, is the NEET PG getting postponed? So my only answer is that right now the date for the exam is June 15th. NBE has not given any official notification, and trust me, anyone who's saying anything does not have any concrete evidence for it. So it's best that you study as per June 15th. So don't even ask anyone else that question before putting it up to yourself. Okay, so now we are done with, I hope, the questions that were cropping in your mind, and I'll start. The rules of the session are that you have to type in the comments, and you have to type fast, and you have to type in short forms, because this is not a test. You don't have to write full answers and waste your energy and time. Write chota short forms mein, give me the answers. I have already written the answers, so I am also not wasting time in writing. We are going to make it very fast, but we want to cover more so that we can have a concise, let's keep a target of 1.5 hours plus minus 15 minutes happens. But then I hope that we are able to put in all the essential information into this session so that it's a very good end day revision list that you guys prepare for. And yeah, one question I forgot, is it for NEET as well as FMG? Yes, it's for all exams. So everyone sitting for any exam in the near future, this session is for all of you. Okay, so let us get going, and starting with the first question. This is one last thing, sorry. There's a similar session which I had conducted many, I think probably 1.5 years ago on YouTube, that is still there. So in case you have a confusion that should I view that or this, of course you are going to view this now, because all the updates I have added in it, some topics I have added extra in this. So this is your final one-liner session that you have to watch. Now we are going and we are starting with the one-liners. So starting with the first one, you have to tell me a list of all the caspases. These are all the cell deaths. So now I'm going to focus on all fact-related things. Images wala to I have taught you in LRR na. So factual things, ratta things we have to finish off here. Let's go. Apoptosis. There are 2 pathways of apoptosis. One is initiation, one is execution. Under initiation, ma'am, intrinsic pathway. Intrinsic, IN, ulta pado 9. So which caspase is going to function over here? Caspase 9. Very good. What about extrinsic pathway? E for 8 and X looks like 10. Excellent, guys. It's a good start. Caspase 8 and 10. Perfect. Now coming to the caspase that we have for necroptosis. So definition of necroptosis was caspase independent programmed cell death. Caspase nahi hai, ma'am. There is no caspase. That's the most important PYQ. Very good. But what is the pro-caspase that can come as a question? And this is going to be pro-caspase 8 can be there, but caspase word, no, caspase independent. Very good. This is a question that came very recently in the exam. Pyroptosis, that is also a cell death. I hope you remember pyrogen means fever. This is the cell death in which patient has fever. So what are the caspases? Long list. Excellent. 1, 4, 5, 11. 1, 4, 5, 11. Out of these, it is caspase 1 which will go and activate interleukin 1, and because of interleukin 1, the patient will have fever, and this entire topic is done for you. So caspase number 1. That is how I'm saying na topic I have picked up. I have not picked up one sentence as a one-liner. This is one-liner as per me, all the caspases. Let's move on to the second one. The second one that I have is going to be the role of sirtuins. Now this question has been asked in all exams, especially FMG, that what are the role of sirtuins or what are the benefits of sirtuins. We have learnt it as ABCD, right? So ABCD is A for what? Anti-aging. So if you want to live for 100, 150 years, then try to increase sirtuins in your life. How will you increase the sirtuins in your life? You will have to eat less and drink more. That's just a way of learning. Don't start implementing it. You will have to eat less, which means you will have to decrease the calories, and you will have to drink more, means there should be more consumption of red wine. Eat less, drink more. That's how you increase sirtuins. One benefit, anti-aging. Perfect. I've got the other answers also. Now it is said it can be used in treatment of cancer and it can be used in the treatment of diabetes mellitus. That's why we learned ABCD. The FMG question was all of the above. So yes, the answer is all of the above. NEET PG last year question was, hota kya hai? What is sirtuin? And this even FMG students should know. It is a kind of an enzyme. It is a kind of a histone deacetylase. That is the composition or the actual composition of sirtuin. Perfect. Then the next year the question came was, what is Werner syndrome? Werner syndrome is a type of a progeria. Progeria ka matlab hota hai premature aging. Person becomes old very, very fast. By the age of 16, 18, he will have cataracts and Alzheimer's and he might even die. So becoming old very, very fast. That is progeria. What is the defect in Werner syndrome? Yes, DNA helicase. Previous year question. For those who are answering, amazing. For those who are not able to recall answers so quickly, koi depression mein nahi jana, because it's okay. If you couldn't recall it right now, after this session even you are at the same level. So just don't get into any depression. Agar aa raha hai, type it out. Nahi aa raha, then just ignore the comment section. Listen to the session. Okay. Coming to the next one. I hope I'm not asking you the most ghisa-pita question that, okay, what is Werner syndrome? Werner syndrome will refer to MEN1 syndrome, ma'am. M for M, that is totally different. So we are not getting into that. We know it. Okay. Coming to the fourth one. I expect this time they will give you, because bahut zyada air pollution ka baat chal raha hai. Too much AQI and water pollution and etc. So free radicals they might give you. Do you remember the 3 free radicals? The first one is superoxide. After superoxide, the second one is H2O2, and then the third one is hydroxyl. So they'll ask you which is the most potent. The last one, OH, hydroxyl is the most potent. We had learnt it as, oh my god, this is very, very dangerous. OH is very dangerous. How is OH made? Ma'am, OH is made over here either by iron or by copper. Is there a name of this reaction? Yes, iron reaction is Fenton reaction. That has it in its name. When H2O2 is converted to OH, this is iron reaction called Fenton. So now they will ask you, how will you stop? Because all this is happening because of this air pollution and water pollution and chemicals, pesticides, etc. So I want to stop all of these. What will I do? Number one, I will have to correct my diet. That is why your parents keep saying, have vitamins, vitamin A, C, E, have fresh vegetables, fruits, etc. Why do your parents tell you and then you ignore that advice and survive on Maggie? So why do your parents tell you to have fruits and vegetables? Because they want you to have vitamin A, C, E. They will protect you. They will scavenge you. Second, you know that iron and copper are causing this reaction. So remove iron and copper. How should I remove them? Very good. Everyone's right. Ma'am, to remove iron, you will have to combine it with transferrin. To remove copper, you will have to combine it with ceruloplasmin. God has given you transferrin and ceruloplasmin so that iron and copper are busy. Your Fenton's reaction doesn't occur. But the question that comes is, what are the 3 enzymes? This question has been asked in every exam of our country. Which 3 enzymes protect you against free radicals? Number 1 is catalase. Catalase kya karega? Catalase will go, I'll write in a short form, catalase will go and break H2O2. Number 2, we have glutathione peroxidase, GP. Glutathione peroxidase will break both of them. It will break H2O2 also, hydroxyl also. But ma'am, no one is breaking this superoxide. Yes, we have something. We have superoxide dismutase. Superoxide dismutase will convert superoxide to H2O2, and then H2O2 to can be broken by so many things. H2O2 can be broken by catalase also. H2O2 can be broken by glutathione peroxidase also. So indirectly, this is going to be done. Okay, so these 3 enzymes, naam yaad rakhna, they are very important, what we expect in the paper. So this is also settled. Now we have a very lengthy one-liner. This is not a one-liner. This is like an entire topic in itself. all the cellular events of inflammation. Especially for FMG exam, they really like to ask you this question. So there is a mnemonic which you study as MRAT-COP, which I think is known to everyone in their sleep also. If I ask you, you will know MRAT-COP hota hai, ma'am. So what is MRAT-COP? Let us get going. Number one is what? M for margination. The cells come to the margin. The next one is what? Rolling. Keep answering the questions over here also. What is rolling due to? Ma'am, rolling is because of which molecule? Selectins, right? Do you remember what are the types of selectins? We always learn it as English Premier League, E-selectin, P-selectin, L-selectin, and I'm not individually calling out your names, but I'm keeping a track of all the answers that you're giving me. But till now, I have not had to comment on anyone because everyone is giving right answer. So rolling is because of selectins, EPL. So rolling bhi ho gaya. Now what do we come to with A? A for adhesion. Adhesion is because of what? Adhesion is due to integrins. What are the two types of integrins? Beta 1 and beta 2 integrin. Perfect. After adhesion, the next one, MRAT-COP, T for transmigration. Transmigration or diapedesis. Kyun hota hai? It is because of PCAM1 or CD31. I don't even know how many times this question has come in FMG exam. 10 times to hai hi. I can't even count it. I've lost count. Transmigration is also known as what? It is known as diapedesis. It is because of PCAM1 or CD31. So now it's going on to MRAT-COP. So okay. MRAT-COP, the next one is C for chemotaxis. Okay, chemotaxis means moving, taxi mein jana, movement of the white blood cells. So the next question is, what are the endogenous chemotactic agents? The agents that we make endogenous from inside our body. What is the mnemonic? Perfect. LIC. Okay, what is LIC? It is going to be leukotriene B4, I for interleukin 8 and C से confusion होगा, C5A भी होगा, C5B भी होगा option में. Remember, chemotaxis is chemo attraction, to attract a white blood cell. You want to attract it. For attraction, you will use C5A, C3A, C4A, all AA molecules. Because after chemotaxis, the next step is going to be opsonization. And ma'am, in opsonization, we all know we have to cover the bacteria na tasty karne ke liye. Which is the best opsonin? The best opsonin is going to be IgG. I have always called IgG as garam masala because garam masala will make the bacteria tasty. That is opsonization. But if I ask you which is the most best complement opsonin, now the answer becomes C3B. Can you see opsonin में BB molecules लिखना, attraction में AA molecules लिखना, that you don't have to mess up. And the last step after MRAT-COP is eating the bacteria, that is phagocytosis. This is where they will ask you a question. MRAT-COP sequence में होता है, so don't mess up over here. I hope that is okay. One error, I'll tell you what you'll do in the exam. Exam में ना, you have learned MRAT-COP, so you learn in that alphabetical order कि MRAT-COP ये sequence लगाना है. But examiner will twist the words. Instead of transmigration, if examiner only writes migration, you might confuse this to be margination and then make this the step number 1. Please don't do such errors. The first step is going to be margination. The next with T is transmigration. तो अगर सिर्फ migration लिखा हुआ तो that is completely transmigration. That doesn't become step number 1. So in the exam, please don't be in that complete delusional state where you're only reading MRAT-COP and you're not putting any sense into it. Okay. Moving on to the next one. अब सब कुछ पढ़ लिया तो the next one-liner, I don't know if these are even one-liners or not, but anyway, the next set of topics is going to be everything to do with defects. These are all the defects. They will ask you कि अच्छा सारों का मुझे gene बता दो, what is the problem. We have leukocyte adhesion defect 1 and leukocyte adhesion defect 2. So LAD1 and LAD2. LAD1 looks like I, so this is a problem in integrin, integrin beta 2, whereas LAD2 looks like 2 flip karo S, so this is a problem in sialin Lewy X. Everything written over here, will be a child coming with infections. Sabka history same, child coming with infections. You will have to read after it. कि अच्छा LAD1 में क्या होगा मैम? LAD1 में extra will be that the mother will say umbilical cord did not shed off, did not separate. Very good guys. Delayed umbilical cord shedding is LAD1 versus which blood group is LAD2? This was the last year FMG exam question. Which blood group is LAD2? Bombay blood group is associated with LAD2. That doesn't mean that every person born with Bombay blood group has to have LAD2. This is just an association. But ये question नहीं था. Question was, what is the phenotype? How do you write? Like if let's assume I am B positive, in my report it will be written like this, that ma'am you are B positive. If you are AB positive, I will write your report like this. But if you're Bombay blood group, how will I write your report? Bombay blood group is written as capital O and small h. This was the FMG last year question. OH. They will say OH is associated with which kind of a disease? With LAD2. Coming to the next, Bruton's hypogammaglobulinemia. How can you forget? B for boys में ज़्यादा होता है. B for BTK gene का defect. Okay, what happens because of it? Hypogammaglobulin. Ma'am, IgG will decrease. The garam masala will decrease. This means the opsonization is going to be defective. Very good. सब कुछ B. Everyone remembers. Amazing. Coming to the next, Shediac-Higashi syndrome. I expect something around this time. Shediac-Higashi syndrome is a problem in the lysosomal gene, the list gene defect. बच्चे को क्या होगा? सब में infection. One classical hair finding. बच्चा comes into your OPD from a distance. You see his hair, his eyebrows, his eyelashes. It has a characteristic silvery gray color, and you are dealing with Shediac-Higashi syndrome. Very, very good. Coming to the last one, CGD, chronic granulomatous disease, is because of a defect in FOX gene. क्या होता है FOX gene? PHOX. Ma'am, FOX gene is NADPH oxidase deficiency. FOX gene is not working. NADPH oxidase is not going to work. What will the patient have? Of course, infections. But which type of infections? Catalase positive infections. That I'm not answering today. Catalase positive अपना homework मान के चलो, because on June 5th when I meet you for microbiology, I have to teach you. Then let's save time. All those Staphylococcus aureus, Candida, those kind of catalase positive infections keep happening in CGD. Now comes the previous year question. What is the screening test? Chota wala test and then diagnostic wala test. Chota wala test is NBT test, and D for D, diagnostic wala test, is going to be the DHR test. These are the two tests that you have for CGD. Is that okay? NBT, DHR, NBT chota test, screening test, DHR, D for D, that is a diagnostic test. Done. Now sixth one-liner if you call so. Moving on to the seventh. Although these are images, but I have to make you revise because we did not do this in LRR, so I thought why not today. These are a list of the giant cells. Either they will give you a match the following, or they will say that okay, tell me the disease. ऐसा कुछ ही आता है इस पे, nothing else. So when I say Langhans giant cell, how did I identify Langhans? Ma'am, because look at the nuclei, perfect. They are arranged in a horseshoe shaped nuclear configuration. कौन सा disease बनाया? Who does not know that Langhans giant cell is TB? I hope you are now very much advanced in your preparation. Langerhans तो नहीं बोला ना? This is not Langerhans, because Langerhans is an antigen presenting cells. This was Langhans, totally different. Coming to the next one, two-tone giant cell, goal, two-tone giant cell. Look at the nuclei. They are also arranged goal. That is known as wreath-like arrangement. It is seen in a goal lipid wala disorder, goal wala disorder, that is xanthoma. Xanthoma is a lipid disorder. Can you tell me one stain for lipids? Because they will ask you, what is the stain that will go and stain the two-tone giant cell? You'll say, okay, two-tone giant cell is seen in lipid disorder, xanthoma. So lipid का तो सबसे famous stain which ma'am has been shouting out since years together now is going to be oil red. Oh, how can we mess up? Indirect way of integrating, done. Moving on to the third one, Worden-Finkelday giant cell. Worden-Finkelday giant cell को पहचानने के लिए they will have to give you a zoom in photo. They can't give you छोटा सा photo, but they can do anything, ma'am. At the end of the day, they might not even give the photo, उनकी मर्जी. But if they give you a photo, you will always see nucleus के अंदर there are inclusions. Those inclusions are made up of measles, because Worden-Finkelday giant cell is measles. But then ma'am, you said उन पे भरोसा नहीं करना. Examiner might give you blurred photo, might give you आधा photo, might not give you a clear photo. Then how will you select? Worden-Finkelday giant cell is seen in measles. Measles में 3 C's का history होगा. What are the 3 C's? That is going to be cough, coryza and conjunctivitis. If this history is given automatically, cough, coryza, conjunctivitis, अच्छा ये measles है, measles का giant cell, Worden-Finkelday giant cell, I don't even need the photo then the examiner giving me or not. Okay, giant cells are done. Moving on to the next one, that is going to be the granulomas. Now you've got photos also, you've got, again, इसमें ना simple question आता है, match करके बता दो. That's all that they can do, not much to explore out here. So when we say Dirk granuloma, these look like two parallel lines, and inside these two parallel lines there are dot dot dot. Dot 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 is what? It's a parasite, ma'am. Dirk granuloma, Dirk is seen in dimag, means it's seen in cerebral malaria. Which parasite? Very good. Plasmodium falciparum causes cerebral malaria, right? So these dot 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 is Plasmodium falciparum. Coming to the next one, the classical, who can mess up on this? Donut granuloma. Donut में से Q बनाया. Where do you see it? You see it in Q fever. Tell me a micro question. Which is the bacteria, virus, fungus? Who causes Q fever? Q fever is caused by Coxiella. Coxiella causes Q fever. Okay, moving on to the next one. Who's messing up on this? No one. Star likha hai, star bana hai. So this is a stellate granuloma, common sense. They will ask you the diseases. It is seen in cat scratch disease and LGV. This you know. Tell me the bacterias. That is what you forget. Cat scratch disease is caused by which bacteria? It is obviously it's caused by the scratching of cat. I mean obvious. But when the cat scratches, what bacteria comes into our body? It is going to be Bartonella henselae. That is good. All of you know. What about LGV? LGV is lymphogranuloma venereum. कौन कराता है? Chlamydia trachomatis. That causes LGV. So I hope you are not just randomly reading diseases. Everywhere you come to a disease for micro, that's the only way to survive. Ask yourself, कौन सा bacteria था, कौन सा virus था. Only then multiple revisions of micro can help you sail your boat. Otherwise, you know the boat is always on the verge of sinking when it comes to micro. Okay, coming to the ninth so-called one-liner, as I am saying it. Ninth topic. So wound healing. These are all fill in the blanks that have come. You will fill in the blanks for me today. When I talk about granulation tissue is that red color tissue. Whenever we get hurt, that red color tissue made of blood vessels, that is going to start on which day? So it begins on day 3 and it becomes maximum on day 5. Everything ka, I told you, beginning of everything, if you forget, starting day of everything is day 3. So if I ask you, collagen formation also begins on which day? You will say, ma'am, everything ka starting was day 3. Granulation tissue starts on day 3. Collagen also starts on day 3. But maximum hona is different. Granulation tissue becomes maximum on day 5 and collagen becomes maximum on day 21. Perfect. We had learnt it as 3-5-3. ये क्या था 3-5-3? 3 day, 5 day, 3 weeks. So everything was starting, granulation tissue and collagen. अगर start वाला day पूछा तो मैम start was 3 days. But when does granulation tissue become maximum? On 5 days. When does collagen become maximum? It is on 3 weeks. That is 21 days. So 3-5-3 करके याद रखना, which I can see all of you remembered. Okay, this is a surgery PYQ that was asked. Collagen formation in the beginning, जब starting में day 3 पर हुआ तो which type of collagen was forming? All of you are saying collagen type 3. Okay, agreed with you, because collagen type 3 is heavily present in blood vessels. Starting mein ma'am we have a lot of red color tissue, we need a lot of blood vessels. So starting mein we make collagen type 3, but towards the end of the repair we converted to collagen type 1. Reason being that collagen type 1 is the strongest. It's the collagen that is present in your bones and also it's very strong. So in the end you want ke strong wala collagen hona chahiye. This was your surgery question. Okay, this is a question which has been asked since 10 years. I'm seeing this. 100% wound strength. When does a person come back to normal after getting injury? Ma'am 100% तो कभी भी नहीं. 85% तक आ सकता है, but 100% never ever. This you will never forget, I know. Okay, moving on to the 10th topic of the day. Trinucleotide repeats. You have fill in the blanks. I like these kind of sessions. I'm sure you do also, because they remind you of the school days where you used to keep your hand on your copy and you used to ask yourself those questions, especially in grammar of Hindi and English and other languages. That is exactly how we are doing it today. So okay, we have trinucleotide repeats. Fragile X syndrome ka perfect. CGG repeats. How many CGG repeats will make it Fragile X syndrome? Your options: less than 55, 55 to 200, or more than 200. And this is especially for FMG students. I've always taught you, ab ki baar 200 par, which is your favorite FMG slogan, is what is Fragile X syndrome. More than 200 CGG repeats should be there. Very good. There is one paradox which is followed, that you know every generation will have more repeats. Like if Dadaji had 400 repeats, then the next generation will have 500, then the next generation will have 1000. What are the repeats are increasing? What is that? Sherman's paradox. Yes, there is going to be an increase in repeats with generation. That is something which they ask you. Sherman's paradox is seen in which disease? And Fragile X will not be written in the options. They will say Sherman's paradox is seen with which kind of disorders? Options will be trinucleotide repeat disorders. That's how you will mark the exam question. Okay, which is the most characteristic clinical feature of Fragile X syndrome? Large testicular size. Yeah, okay, many of you gave it macroorchidism as a name. I agree, that is large testicular size. What is the investigation of choice for Fragile X syndrome? It is going to be polymerase chain reaction. Polymerase chain reaction is the investigation of choice. And if investigation of choice fails, then what are we going to do? We are going to do southern blotting. You might feel that ma'am, ye biochemistry ka blotting kaun पूछता है? It's such a useless question now. But let me tell you, the recent INI CET exam had a question on blotting. I'm just writing it in very short form because we all know north, south, west and east. 4 type ka blotting: northern, northern, southern, western and eastern. And we know that roti, dosa, pizza, mnemonic. Now north mein there is roti consumption, so you do it for RNA. South mein there is dosa consumption, so you do it for DNA. West mein there is pizza consumption, so you do it for protein estimation. East may, they asked you, usually Eastern blotting, which I think you will forget in the exam, is going to be for post-translational modifications. If this is not given, what do you mean by post-translation? After translation. After translation matlab, what is translation in biochemistry? Protein ban chuka hai. In other words, they are talking about some protein modifications. They might ask you enzymatic analysis is done by which? Enzyme is a protein usually. So you will say, okay, enzymatic protein ki baat ho raha hai, so they are talking about Eastern blotting. Is that okay with everyone? So northern blotting for RNA, southern blotting for DNA, western blotting for protein, and then eastern blotting for enzymes or post-translation. Someone asked me, what is anticipation? Anticipation is the other name of Sherman's paradox. Anticipation in English means that you are kind of able to tell what will happen tomorrow. So you are able to tell that acha agla generation they will have more number of repeats. You become like an astrologer and you can do future telling. You can anticipate. Like I can anticipate by looking at the answers over here that all of you are going to get amazing scores and ranks in the exam. That is my wish and my anticipation. So I'm able to see the future and tell you. Same way, that is anticipation. Okay, coming to the next. Many of you have already given me answers. Myotonic dystrophy में क्या चलता है? Ma'am, that is CTG repeats. आपने कहा था fragile X का CGG and इसका CTG because myotonic dystrophy का CTG. TT comes in the center. Chromosome is also asked. Don't think I will not ask you extra questions. I'm like the typical bad Viva examiner जो एक answer बताओगे तो I will ask you 2 more. So since you told me CTG, it will be present on chromosome number 19. Perfect. What facies? Meanwhile, everyone is right. Ma'am, very sharp jawline facies called hatchet facies. Which kind of cataract? Christmas tree cataract. Perfect. So we learn it as CTG and then we learn it as Christmas tree cataract. Tell me, where do you see Christmas tree polyps in pathology? In GIT, where do we see Christmas tree polyp? That is Peutz-Jeghers polyp is going to be Christmas tree polyp. Okay, tell me the other ones. What about Friedreich's ataxia? Remember, friend Gana ga raha hai. So those are GAA repeats. And who can forget Huntington disease? Hunting in a cage. So which repeats are those, ma'am? Those are cage, CAG repeats. Which chromosome? Cage has 4 walls, char divari. So cage has 4 walls. That is chromosome number 4. All of this is done. Moving on to the 11th one-liner. That is all the syndromes. This was also something asked indirectly in this INI set and last FMGE and NEET. Everywhere some question on this comes. So that is Prader-Willi syndrome and Angelman syndrome. These are imprinting and deletion wale disorders. Common points क्या है? दोनों का chromosome is chromosome 15. Okay, then what is the difference? Prader-Willi is because of a problem in the SNORP gene. So see, SNORP gene, P for Prader-Willi. Angelman syndrome is UBE3A gene का problem. जो gene का ending disease का नाम. SNORP gene is known as defect Prader-Willi. UBE3A gene का defect is known as Angelman. Both of these genes are present on which chromosome? They are present on chromosome 15. A problem बता दो ma'am. You will tell me. Remember, Papa region deleted is how we learnt it. Prader-Willi is Papa region deleted. So paternal deletion and maternal imprinting. So if Prader-Willi is Papa region deleted, Angelman will be Mama's region deleted. Maternal deletion and paternal imprinting. I hope you're not messing up on this rest because एक भी याद कर लिया. Papa region deleted, Prader-Willi done. This means Angelman में Mama region deleted. Angelman syndrome babies are also known as they always keep laughing. OPD में बच्चा आएगा, he's like laughing without any reason, हंस रहा है. That is known as happy puppets. Perfect. I think we know this word will be written and you will know your answer of Angelman. Okay, moving on to question number 12 or whatever, one-liner, whatever you want to call it. Karyotyping पे एक quick revision. Okay, you can see this is one karyotype over here. This is another kind of karyotype. मतलब chromosome देख रहे हो मैम in short. So karyotype is going to be done on which phase? Which is the best phase? Perfect. It is going to be metaphase. After you have arrested the cells in metaphase, you are going to apply a fixative. What is the name of the fixative? CAR का fixative CAR. So the fixative is going to be Carnoy fixative. See, karyotyping is going to be Carnoy fixative. Why am I saying Carnoy? Because options में carne complex, carni ऐसे अलग अलग spellings will be there to confuse you. Option will not be simple one. It will be carnoy, carnes, carnes, and then you will really break your head कि क्या था वो? What did I read? So Carnoy. That is how you will learn it. Okay, what is Carnoy's fixative? This they will tell you. Okay, you have a bottle of methanol, you have a bottle of glacial acetic acid. कितना mix करना है? You will mix it in what? You will mix it in 3:1 ratio. Remember Carnoy, our favorite kind of mnemonics, alphabet or letter ka counting. C is the third alphabet, A is the first alphabet. So Carnoy fixative 3:1 का ratio. We all know. Everyone's going way ahead of me. Ma'am, हमें most common banding हमने बता दिया. Most common banding is G banding. What does G stand for? It stands for Giemsa stain, and you will use a simple light microscope to use it, like you have used it over here. This is G banding, simple sa light microscope. But if you want to use this fancy wala microscope, fluorescent microscope, then what is the banding that you use? You use Q banding. Q stands for what? Very good. Quinacrine. Queen के लिए fancy वाला microscope, that is how we had learnt it. Giemsa के लिए गरीब वाला microscope. G banding, Giemsa, गरीब microscope, that is light microscope. Queen के लिए fancy microscope. So this is also done. Okay, now I'm done with this. Moving on to I think the 13th topic that we have. So you will eventually realize 100 one-liners से कहीं ज़्यादा है, because if you start counting the number of one-liners, it's much more. But I wanted that in 1.5-2 hours we cover maximum possible, so that that's your last day revision. Last 2-3 days, this is what you do eventually. Let's start. सारे amyloids के नाम you will tell me. Multiple myeloma, plasma cell cancer means production of, so everyone knows all these AAA is amyloid. You have to tell me which type of amyloid. So multiple myeloma, cancer of plasma cell, light chain बनेगा. तो मैम AL type of amyloid, light chain. Very good. Medullary carcinoma, thyroid, recent exam question was asked last year also. Medullary में calcitonin बढ़ता है. तो which kind of amyloid? ACAL type of amyloid. Very good. Any kind of inflammation, chronic pancreatitis, chronic appendicitis, chronic osteomyelitis, कोई भी inflammation, कोई भी cancer, renal cancer, Hodgkin lymphoma, non-Hodgkin lymphoma, and कोई भी fever like familial Mediterranean fever will show you AA. All cancers, all inflammations, all fevers, but there is one exception. Very good. One chronic, not one chronic bronchitis, that does not show you any amyloid. Rest all chronic inflammations show you amyloid. That is AA type of amyloid. Now we come to Alzheimer's. Alzheimer's में क्या बनता है brain में? Ma'am, in the brain there is formation of beta plaques. So A beta amyloid. In hemodialysis, what rises in the blood? Beta 2 microglobulin increases in the blood of the patient. So A beta 2 type of amyloid. We had learned एक brain होता है. Hopefully it works in the exam. So एक brain, Alzheimer's brain disease, one brain, one beta. Hemodialysis, kidney disease, two kidneys, two betas. Remember that? Yes, one brain, one beta, two kidney, two beta. Okay, coming to the next one, the toughest names हमने easy करा था. Systemic senile amyloidosis मतलब old age वाला amyloid. Familial amyloidotic polyneuropathy means nerves वाला amyloid. Old age का amyloid, nerves का amyloid. In both of them, there is an increase in TTR. TTR stands for transthyretin. I am not writing the full form, hoping that you know. Transthyretin, which would mean that age बढ़ता जाएगा, तो मैम quantity में problem है. Age is going up, quantity is going up. Whereas in nerves, it is a mutation of TTR that is going to happen. So is that okay? Age is going up, the quantity is going up, and in nerves a problem, so then mutation has occurred. All the amyloids are done. Now you will tell me the organ related questions. Amyloid deposition in the spleen and the liver, etc. So amyloid deposition spleen में दो जगह ना, red pulp and white pulp. What do you call those appearances? In the red pulp it is known as lal red, lardaceous spleen. Yes, and in the white pulp, think of white. Sago, sabudana is white. That is why you call it sago spleen. Sago is the basically sabudana, which is white in color. So lal for red pulp and sago, sabudana, white for white pulp. Okay, what about amyloid in the liver? There's no appearance, but they ask you that what is the space or what is the area where amyloid will go and get deposited. That is going to be in the space of Dc, where it goes and gets deposited. Perfect. Okay, this is Ghisa-Pitta question. Best stain for amyloid, as all of you know, it is the Congo red stain. But you know, it's my duty to have this as a question in every session. Otherwise, I'll feel incomplete, right? So best stain Congo red. Congo red, kaun sa birefringence, apple green birefringence. Which microscopy will you use? Polarizing microscopy. Very good. But this is now kind of too old a question. They will ask you what is the stain of amyloid for which you will require ultraviolet light. Now that stain is thioflavin T. We had remembered thioflavin T. T के आगे अगला alphabet देखो T, U, V. So thioflavin T needs which light? Thioflavin T is going to use UV light. So all these questions are also done. Now I come to a one-liner, if you can call it, but a huge table of all antibodies. I've got all autoimmune important wale disorders. You will make a table of all antibodies. This will really help you in medicine, trust me, because some match the following or autoimmune question always comes in the paper. So get going and start typing. I'm first starting with SLE. If I ask you which is the most sensitive antibody over there, anti-nuclear antibody, which all of you are calling it as ANA, anti-nuclear antibody, perfect. But which is the most specific? That is known as anti-Smith antibody, and anti-Smith is also referred to what? It is referred to as ASA, perfectly correct. But कौन सा दोनों मैम, दो अलग अलग क्यों करना? Tell me one antibody which can serve both purposes, sensitive also, specific also. Double benefit के लिए anti double stranded DNA antibody, dsDNA. So double stranded DNA has double benefit. Now coming to neonatal lupus, SLE occurring in neonate रोता है, crying. So anti-ro, rona मतलब neonate rona, anti-ro antibody, perfect. Coming to the next one, lupus with psychosis. P for psychosis, so that is associated with anti-ribosomal P antibody. P for psychosis, P antibody, that is how we learned it. SLE is done. Tell me all the antibodies of Sjogren's syndrome. Before that, tell me how will a history of Sjogren's syndrome come? It will be dry eyes as well as dry mouth. Why would someone's eyes and mouth be dry? Ma'am, eyes will be dry because lacrimal gland ka problem. Mouth will be dry because salivary gland ka problem. What problem? Antibodies are going and killing them. What are the names of antibodies? How simple? SS for Sjogren's syndrome, anti-SSA, anti-SSB. Anti-SSA and B are known as RO-LA. So everyone learns it as RO-LA antibodies cause it. So dry eyes and dry mouth are caused by RO-LA, out of which RO is sensitive and LA is specific. कोई mnemonic नहीं needed ना. RO-LA याद रखा. RO is sensitive, LA is specific. Sjogren's syndrome खत्म. Coming to a dermatology question, that is going to be scleroderma. Now sclero tells me okay, sclerosis, stiffening, stiff thickening होगा. Derma means it's going to happen in the skin. If it occurs in limited, like it only occurs in the fingers, limited part of skin, that is limited scleroderma. But if it happens everywhere, in the face also, if it happens in the organs like esophagus, it happens in the hands also, on the trunk also, so it's happening everywhere, then it is diffuse. इनका antibodies बता दो. तो मैम अगर limited है तो that is anti-centromeric antibody, and अगर diffuse है तो anti-topoisomerase antibody. How have we learnt it? Limited means it is centered to one place. So limited is because of anti-centromeric antibody. Diffuse means total body is involved. Total body is involved because of topoisomerase antibody. Scleroderma, so topoisomerase is also known as anti-SCL70. SCL is scleroderma antibody, means the same. All your antibodies have come down to one page. Now I'm going on to something very difficult, to all the mutations. This question by the way came in the recent exam, तो एक mutation तो पक्का आएगा. You like it or you dislike it, I don't care, you will have to study it. So start studying with me right now. Red का तो there's a song which I've always taught you. So 2 slides on all mutations. I think 10 one-liners will be done in this. You've started singing the song. Red 10 Medmen. Few days back, I had seen that our surgery faculty had also posted something about red gene, and all of you had not given the answer to it, but you had written red 10 Medmen over there. So you've been singing this song at a lot of places, I've noticed. So what is ret? Ret is going to be, ret is the name of the gene, ma'am. 10 is of course the chromosome. The med stands for, it causes, mutation causes medullary carcinoma thyroid. Right now I told you medullary carcinoma thyroid shows you which kind of amyloid? Calcitonin बढ़ता है, ACAL type of amyloid. And MEN stands for MEN2A and MEN2B are the syndromes. So red 10 Medmen we know. Coming on to C-kit or CD117, you started saying the mnemonic games. Ma'am, whenever we go to play games, we carry a kit with ourselves. What is games? G for gist, very commonly asked in every exam. Gastrointestinal stromal tumor. Games में आगे पीछे भागते रहो, which means AM together is what? It is going to be AML. फिर आगे भागो, ME is what? It is going to be melanoma. Then the last alphabet S, वापस भागो. What is SE? SE is going to be seminoma. Games में यही तो करना है ना, keep running. When you forget, अच्छा, what was with A? Was it ALL or was it AML? What will you do? You will run like in a game. You will run forward and take the next alphabet. अच्छा, it was AML. What was with M, I wonder? So I run forward. Oh, ME was melanoma. What was with S? I run back. It is going to be seminoma. So games में आगे पीछे भागना, C-kit or CD117 mutation. Perfect. What about BRAF? There are 6 tumors that can occur with BRAF, but even if you answer 2 most important or 3 out of those, it's more than enough. But please note the first 2 you have to know. When you read it left to right, it comes across as LCH. If you read it right to left, it is HCl. So LCH is Langerhans cell histiocytosis. Ulta pado HCl, that is hairy cell leukemia. Both of them are going to show you BRAF mutation. So left to right, right to left. What next? The PP tumors show it. Which is the P tumor in the thyroid? Papillary carcinoma thyroid. Which is the P tumor in the brain? again it is pilocytic astrocytoma. Okay, both of these. And for NEET PG students, you have to learn two more. That is CM, colon cancer, and melanoma can also show BRAF mutation. So BRAF is LCH and HCl, P and P, and CM. These are the 6 tumors which can show BRAF mutation. To be very, very precise, it is BRAF V600E mutation of how it will be written in the paper. That is the complete mutation. Now, mutations are not over. There is a very, very long list left. How can we forget the RAS and the MYC? In par to ek question aana hi aana hai na, ma'am. So RAS is the mutation. How many types of RAS? How can you forget? Rasta kahan hai? There are 3 types of RAS: KRAS, HRAS, and NRAS. Is that okay with everyone? So KRAS, HRAS, and NRAS. So okay, let me start with KRAS. KRAS is for couple tumors. Couple. So sometimes our mnemonic K say I can't think of what. I can think of K sounding wala. So colon cancer, pancreatic cancer, and lung cancer. KRAS mutation is seen in couple tumors. What is with HRAS? We had to do a little bit of drawing over here. This is very tough, but we have to revise. HRAS में क्या होगा? So ma'am, we had made a kidney out of it. So kidney and bladder वाले cancers में you see it. NRAS, if you are appearing for NEET, you should remember. For FMGE, you can skip. N is seen in all the M wale tumors, like it is seen in AML, it is seen in melanoma. So please note, NRAS mutation is seen in all the M wala things. Moving on to the next one, RAS ka to KHN we have studied. What about MYC? There are 3 MYC: C-MYC, L-MYC, and N-MYC. Repeating, C-MYC, L-MYC, and N-MYC. C-MYC mutation childhood, एक African child वाला lymphoma होता है. We all know, starry sky appearance, African child. Burkitt's lymphoma. So C-MYC mutation is seen in Burkitt's lymphoma. What about L-MYC? L for L. L matlab small cell lung cancer. Small cell lung cancer में L-MYC mutation होता है. What is N? N for N, ma'am, it is going to be neuroblastoma. How simple ना? C for childhood का lymphoma, L for L, N for N. नहीं भी कुछ याद आया एग्जाम में, match the following होगा. Something you will be able to make out of it, even if you can't remember it correctly. When the option will come in front of you, you will be settled. So we've done a long set of, I'm stopping the numbering also now because 17th, 18th, whatever it is, because it's irrelevant. You know, I think by now only 100 one-liners का आधा तो हो ही चुका होगा. Anyway, coming back, tumor markers. One question, match the following again has to come on tumor markers. So now start once again typing. Loads for you to type. Alpha fetoprotein. Ma'am, alpha fetoprotein is produced by the yolk sac. So number 1, yolk sac tumor. Number 2 is all the liver related tumors. अब कोई भी liver tumor लिखा हो, if they've written hepatocellular carcinoma or they've written hepatoblastoma. So any liver related tumor and yolk sac tumor. We know this. Okay, what is CEA? This you will get in surgery. C for C. CEA is elevated in colon cancer. Previous year question. ये इस बार का नीट पीजी सॉरी INI-CT में something about CA125 was asked. In that patient, you know, CA125 levels or some marker question was given, that was given with regard to surface epithelial granulosa. तो एक tumor marker आएगा. CA125 are surface epithelial tumors, especially with surface epithelial tumor, serous ovarian tumors, but usually many kind of surface epithelial tumors can be showing you CA125. Moving on to CA199, how can you forget? 9 को flip करा P. Pancreatic cancer, FMG exam का favorite question, CA199 for pancreatic cancer. Moving on to the next, CA15-3. 3 का हमने B बनाया, so that is breast cancer. So these are all. See that the list in the book and the notes is very lengthy. What I've got over here is like what you have to know. Okay, 99% अगर guess लेना है तो these are the tumor markers that they will ask you. That 1% chance, then that remains for the entire 19 subjects. Okay, moving on to the next one. Let's go on to guessing the cardiomyopathies. Okay, how do you guess this? This was a question that was asked. Cardiomyopathy के नाम तो आते हैं. If this is a question, what will you mark? You have to know, and many of you started giving me updates on some NEET PG date or something. I don't want to comment on that very honestly, because abhi till the time I don't see the official notification, I won't discuss that. Otherwise, you never know what's being circulated. I don't want to comment till I don't see it. So that is after the session, I will tell you. Okay, anyway, guess the cardiomyopathy. Pink amorphous extracellular material depositing in between the cardiac fibers. Cardiac तो ठीक है. Whenever they say pink extra cell, cell के बाहर, that is always amyloid. pink extracellular material. So amyloid going in the heart, which cardiomyopathy? Perfect, restrictive cardiomyopathy. Most common cause of restrictive cardiomyopathy is amyloidosis. Abhi to pada tha amyloidosis, Congo red, etc., etc. Now tell me that if amyloid goes and sits in the heart, restriction in what? Contraction mein restriction hai, that is systole problem, or diastole. So please note, in medicine they will ask you, this causes diastolic dysfunction, relaxation. See, someone comes and sits in your house, unwanted relative, will you be able to relax? Of course not, ma'am. Similarly, unwanted relative amyloid comes and sits inside the heart, will the heart be able to relax, cause diastole, relaxation? Nahi ho paega. So diastolic dysfunction is what is going to occur. Okay, guess the next cardiomyopathy. Okay, this I think is obvious, but you will tell me that if it is an alcoholic patient, we always know I'm talking about DCM, which is written also over here. तो अगर alcoholic patient होगा तो DCM. अगर genetically पूछा DCM में कौन सा mutation, तो titin mutation. Imagine all of this is given. Either it is an alcoholic patient or it is a titin gene mutation. They will ask you DCM, dilated cardiomyopathy, shows you which nucleus. That's the question. Perfect. The good news is this is the only picture of ninja star nucleus available on the internet and in the book. देना है तो यही photo देना पड़ेगा. It is like they don't have an option. So you can see the nucleus looking like an exact ninja star. That is a classical case, and we have always learned that once someone consumes alcohol, he starts anyway feeling and thinking of himself like a ninja. So you will never forget, whenever someone consumes alcohol, dilated, he starts feeling he's very big and very strong. He starts feeling like a ninja. So that is what you have to know over here. Moving on to the next one, severe emotional stress. And there's only one cardiomyopathy that you have to think of. Either it is some property dispute happening in our country. हमारे country में दो ही emotional stress देते हैं exam में. Either it's some property land dispute happening between brothers, or it is the death of a close family member. Usually there is a female who has recently lost her husband. That is their favorite history. It is always because of caused by Charcot-Marie cardiomyopathy. So this leads to Charcot-Marie cardiomyopathy. I can see only one ventricle of the heart is becoming like this octopus catching pot. It is the left ventricle that is dilated, and like you can see over here, it is known as broken heart syndrome because of emotional stress. I'm not writing, ये हमने LRR में पढ़ा था. Emotional stress मतलब catecholamines are releasing. When too much of catecholamines release, that is when Charcot-Marie cardiomyopathy can occur. Only the left ventricle will get affected. Moving on to everyone's favorite cardiomyopathy. There is a sudden death or a collapse in a young athlete. Their favorite history is a 19-year-old basketball player who suddenly collapses on the field. A 19-year-old football player. Somehow he's always 19 years. Either he's playing basketball or football or running a marathon. इनका यही आता है ये. Same history. It is always hypertrophic cardiomyopathy. What is the mutation in hypertrophic cardiomyopathy? Rearrange the alphabets. HCM का आगे पीछे किया तो MHC, MYH, something to do with muscle ना, because it's a myopathy. तो myosin heavy chain or myosin heavy chain, however you may want to like it. How is the gross appearance? How can we forget the very famous banana shaped heart? All these small things on the side which I'm just making you revise from LRR. LRR में तो बहुत डिटेल में करा था. Then how does it look under the microscope, ma'am? All the cardiac fibers are going here and there. So that is known as the helter-skelter appearance of the cardiac fibers. That's another PYQ, banana shape and helter-skelter. Okay, this is also one more thing. Since you've given me such nice answers, this is an autosomal dominant disorder. So they will give you in the history that patient ke father ko or someone else in the family had it. Moving on to the next set of questions, they have really started asking you questions on cardiac tumors, which once upon a time was not very famous, but now is. So there are only two cardiac tumors. I always write it as Mr. like this, heart में, because left atria में जो होता है, that is myxoma, and left ventricle में जो होगा, that is going to be rhabdomyoma. These are the only two cardiac tumors that they know. So they ask you, which is the cardiac tumor with lipidic cells? Lipidic cells wala is going to be myxoma, and myxoma you just now saw occurs in the left atria. Versus which is the cardiac tumor with spider cell? Look at this cell. The cell is looking exactly like a spider web. So spider wala is rhabdomyoma, and that tends to occur in the left ventricle. One more thing, myxoma ऊपर है तो वो बड़े लोगों में होगा, that is going to be adults. Rhabdomyoma नीचे, that happens in chota people, so it occurs in children. So please note, myxoma occurs in big people and rhabdomyoma occurs in small people or occurs in children. So that is cells per question आएगा, especially FMG students. Lipidic cell, myxoma. Spider cell is going to be rhabdomyoma. Okay, moving on to the next. How can I make you do in every session, because one question has to come. So even if you're bored of it, you will have to do it. Let's give you a target of 40 seconds for this entire slide and you have to fill it all up. I don't know how many one-liners. So which is the most common vasculitis in adults? अभी peds वाले age group में नहीं गए, adults में गए हैं. Very very good. Temporal arteritis, also called giant cell. Giant cells दिखते हैं मैम, temporal artery तो दिख ही रहा है. Okay, so when you say giant cell arteritis, called temporal arteritis, which is the most common artery? Common sense, superficial temporal artery. If the superficial temporal artery is involved, patient को complaint क्या होगा? It is going to be headache. So there is going to be most common symptom, localized throbbing headache, but that is most common. What is the most? I always point it out by now. Even in the exam, you will remember जब common पूछते थे तो ma'am used to point towards headache. जब specific पूछते हैं तो ma'am points towards the jaw. So that is going to be most specific. That is known as jaw pain or jaw claudication. But then what is the most dangerous? If someone's vision goes away, loss of vision, and then what is that medicine question that I always taught you? कि giant cell arteritis का treatment क्या होगा? We have to give steroids, but do you wait for the pathology report to come or do you start steroids without any report? Ma'am, start steroid stat. Report का wait मत करना. Report का wait means 48 hours you are waiting. 48 hours patient ends up having loss of vision. How will you cure that? That is permanent. He's blind forever then. So start steroids stat ASAP. That is what you do. Acha, this was one kind. What if I give you vasculitis in which I say pulseless disease? The radial artery I cannot palpate. Very weak it is. Which arteritis will you think of? Takayasu arteritis. That is what you also call as the pulseless disease. Now also I want to ask you that acha, which is the most common vessel? You will say ma'am, usually it is the arch of aorta that is affected. Can I write short forms like this? By now all of you are aware of this. Arch of aorta. Arch of aorta ka kaun sa vessel is most commonly affected? Subclavian artery is the most common affected vessel in Takayasu. So temporal mein to most common temporal you will know, but Takayasu ka most common vessel affected subclavian. That is why the upper limb pulses become very weak. You can't palpate. Upper limb you can't palpate. Means if you want to palpate the radial artery you won't be able to, but if you want to palpate the femoral artery, the lower limb pulses, that will be a good volume pulse that you will be able to palpate. Moving on to the next one. Okay, what is the vasculitis you will think of if the patient is surface antigen positive? Till the time you tell me that answer, let me give you one micro answer. Instead of surface antigen, they write Australia antigen. It means the same. वो hepatitis B surface antigen, Australia antigen. What did you think of? Very good. Only vasculitis in surface antigen HBS or hepatitis B positive is polyarteritis nodosa. Then comes our evergreen mnemonic. P is not for P, which I've used a million times in rapid revision videos. Polyarteritis nodosa involves all the vessels of the body but does not involve pulmonary vessels. PAN does not. P is not for P. This so I think even if you don't revise till the exam, वहाँ भी याद आ जाएगा. P is not for P. Okay, now next, this also you know guys, which is the vasculitis with the strawberry tongue. I can kind of visualize ये छोटे बच्चे का mouth है. So this must be occurring in छोटा बच्चा, that is Kawasaki disease. K for Kawasaki, K for kids, because usually seen in under 5-year-old kids. We know cream criteria, perfect. So that I'm not telling because there are some things I don't want to repeat. वरना आपके पास LRR का PDF है. If I write the same things over here, it will be a same PDF which will not make any sense. So we've done all of that. Now I want to ask you a question. Which antibodies are going to be present in Kawasaki disease is the question that I am expecting, because अब बाकी सब तो Kawasaki का they have asked a million times. Why does Kawasaki disease occur is what they can ask you now. Because of the formation of anti-endothelial cell antibodies. ये होगा tough वाला question if they want to ask. बाकी strawberry tongue and kids and all हो गया, काफी बार पूछ लिया. This question came in the last to last FMGE exam. Which vasculitis occurs in smokers? We have learnt as, although smoking can be any smoking, but we have learnt as B for BD and B for Berger's disease. They asked you in FMGE exam that there is a smoker, a cigarette smoker, BD smoker or whatever. He is having Berger's disease. What is the other name of Berger's disease? That was FMGE exam question. Other name is TAO. What is TAO? Please fill in the blanks. It is thromboangiitis obliterans. You can see over here, ma'am, angiitis means blood vessel. Obliterans, blood vessel obliterate हो गया, blood vessel is closed. Blood कहाँ से मिलेगा? How will you get the blood supply? Blood vessel is closed. Who closed the blood vessel? The blood clot, thrombus formation. Why did it happen? Because the person is smoking. Blood clot है, itis means inflammation, blood vessel obliterated. That is why it is called as thromboangiitis obliterans. This was the other name asked in FMG exam. Moving on to the toughest part after this chapter will be done. You have seen these two antibodies which I've asked you like so many times. जितनी बार I ask you, utni baar we forget also. So we will do it one last time. There is something called C-ANCA and P-ANCA. These are what? These are antibodies, ma'am. There are two types of antibodies, C-ANCA as well as P-ANCA. Pehle tell me their other names. We have learned something called CPR. So C-ANCA ka new name kya hai? C-ANCA is known as PR, that is PR3-ANCA, and P-ANCA is known as MPO-ANCA. Pehle to do the ratta wala part. Okay, let's do their old names and new names. Old names were C-ANCA, P-ANCA. New names are CPR, so PR3-ANCA and MPO-ANCA. Why are you teaching us in vasculitis? Because now you will tell me which vasculitis shows you C-ANCA positivity. It is Wegener's granulomatosis. We had also studied something called as World Cup. World Cup tells me Wegener's granulomatosis is the only disease to show C-ANCA. There is no other disease that shows C-ANCA. Whereas P-ANCA is shown by the entire universe. The entire universe over here can show you P-ANCA, that is including Wegener's granulomatosis, microscopic polyangiitis, Sturge-Strauss syndrome, और भी कुछ लिखा तो वो सब P-ANCA. Let me ask you, name one GIT disorder and one liver disorder which shows you P-ANCA, because everything dustbin category is P-ANCA. GIT में मैम ulcerative colitis, excellent, that shows you P-ANCA. liver में ulcerative colitis के साथ ही होता है वो liver का problem. Primary sclerosing cholangitis, this I've taught you in LRR. Primary sclerosing cholangitis, that also causes P-ANCA. So I realized everyone on this planet has P-ANCA. But Wegener's can have both. Wegener's can have C-ANCA also, P-ANCA also. But single best answer for Wegener's, if ever asked, that okay, Wegener's shows you C-ANCA also, P-ANCA also. So World Cup yaad rakhna, more commonly it shows you C-ANCA. Okay, so we are done with this question. All ANCA story is done. This is a question which came 3 times back to back as a hat trick in the FMGE exam. And that is how important it is. In one session, I remember this disease had 2 questions. I can't emphasize more on how important it is. So guess the condition in which the patient has Henoch-Schonlein purpura, if you remember, our only Bengali accent mnemonic that we had made, Henoch-Schonlein purpura, we called it as purpura so that we can learn the 4 things that happen in it. So what is purpura? I will write lots of A's in it. So first, P for purpuric rash. Usually the purpuric rash occurs in the lower limbs. They will say below the buttocks or the thighs, something like that. Joint pain, that is arthralgia. The next A. The next A is abdominal pain. They will say patient has GI discomfort, abdominal pain, something like that. Then R, they will say renal involvement. Patient has blood in the urine. In fact, the most common organ to get affected out of all of these is kidney only. So now, ma'am, 1A is left because which antibody is associated with it? Of course, IgA. So this is also known as IgA vasculitis. If they ever write IgA vasculitis, they are talking about the same thing in Henoch-Schonlein purpura. Age group bata do. You will study this a lot in pediatrics because this is the most common vasculitis that you see in children. Please recall the most common vasculitis that you saw in adults was the giant cell arteritis or temporal arteritis. Most common vasculitis in children is Henoch-Schonlein purpura. I think we are settled with that. Moving on to the next one, which I think has been asked and will continue to be asked in every exam. Identify the condition in which 2 organs are written. There is a lung and liver involvement. And you know what I've done in these one-liner sessions? Basically, I was earlier making you read 4 5-liner MCQs. Now I've taken out the buzzwords and I'm making you revise it. So this is exactly how you will be solving question. Pura question padke, that 2 buzzwords that come your way help you solve a question, right? So that's exactly what we're doing out here. When I say lung mein pan-acinar emphysema and liver mein cirrhosis, the next thing that you will ask me, what is the age of the patient? Let's assume I say this is as young as an 18-month-old baby. So now you're like, okay, this is probably a case of alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin gene, what is the name of that gene? This is for NEET PG students. I have added this in the recent rapid revision also. The name of the gene is the Serpina or Serpina gene. Chromosome has been asked 1,000,000 times. It is chromosome 14. So many times they have asked you what is the gene for the alpha-1 antitrypsin deficiency. It is chromosome 14. What is the name of the gene? Serpina gene. So we have learned that okay, alpha-1 antitrypsin deficiency is an autosomal recessive disorder. Recessive का मतलब ये तो छोटे बच्चों में होगा, which is correct. And छोटा बच्चाs of our country are always given a pet name. Mothers always call the छोटा बच्चाs till their name, till they don't have a name. He is usually called as Lal. So छोटा लाल बच्चा. So लाल will tell you alpha 1 antitrypsin deficiency में मैम 2 organs are affected. There is involvement of lung and there is involvement of liver. In the lung I can see pan-acinar emphysema. In the liver I can see cirrhosis. I mean, I'm kind of feeling bad that an 18, 24 month or 3-4 year old kid is having cirrhosis. Imagine the intensity. Now this lal is going to be diagnosed with the help of a stain. Think of a stain which is giving that lal kind of a color. Lal, pink kind of a color, pink, lal kind of a color is pus. So pus is going to be present. Okay, someone said liver and lung are also for hydrated cyst, which is so right. But then of course these kind of histories will not be given. But that's a very good correlation because hydrated cyst jo abhi likha, now that you've asked me, what is the most common site of a hydrated cyst? It is going to be the liver. What is the second most common site of the hydrated cyst? It is going to be the lungs. So you are right on that. Okay, anyway, this is done. Now I'm going to a question which has come in every exam of our country every year without fail, and I have fingers crossed. I hope it comes this time because you know it. You have to tell me all the markers of lung tumors or cancers that we have. Before I go on to this, can you tell me which is the most common lung malignancy? Which is the most common lung malignancy? Let me ask you a question before you start getting into that mode of ratta in your life. Yes, so most common malignancy, many of you said adenocarcinoma. Bhool gaye this trap, it's so easy for me, you always fall for this. Many of you didn't and I'm very happy, but the most common lung malignancy is none of these. The most common is metastasis, usually a breast cancer coming to the lung or some other cancer coming to the lung. If mets is not there in the options, then I agree with your answer that the most common out of these is adenocarcinoma. Now let's come to the real deal. You have to tell me markers. So for squamous cell carcinoma, we have all PP markers, P40, P63. FMG exam mein pucha tha, out of P40, they went to that depth of this question, which is the best marker. P40 is the best marker for squamous cell carcinoma of the lungs. Now coming to adenocarcinoma, A for adenocarcinoma, all AA and 1-1 wale markers like napsin A. For adenocarcinoma, A is the first alphabet, so MUC1 for adenocarcinoma, TTF1 for adenocarcinoma. Now coming to small cell carcinoma, sounds like an innocent small cell, but I always called it chota packet bada dhamaka, which means it sounds like a chota packet small cell, but now the list that I'm going to show you, may God save you. First set, it is divided into two lists. First list is all the in. Synaptophysin, chromogranin, bombesin. Pehle to in wale markers. Then the next part of the list is all short forms in one place. NSC positive, CD markers like 56, 57 positive, and last year ka INI-CT question, which is the nuclear marker for any kind of small cell carcinoma. You know, that time student, ye to bilkul hi googly question tha INI set ka. No one, even for an MD level student, you give this question and he or she won't be able to answer it. So this was something which everyone had to take a guess. And students being our students, my students, decided, अच्छा intranuclear marker पूछा है तो INSM मार्क कर देते हैं, because उसके नाम से ऐसा हम निमोनिक मैम एग्जाम में बैठ के बना के आए कि INSM sounds like intranuclear, so that must be the intranuclear marker, and somehow it worked in their favor. I mean, the full form is not intranuclear and you don't have to know the full form, but sometimes when you take that safe, or you just take a random guess, but that's how you've been studying and probably the universe works in your favor, this is exactly how things go. So the intranuclear marker out of this is going to be INSM. So first you have in, and then you have all the short forms. This is all for small cell carcinoma. Now this last question is only for NEET PG students, not FMG students. Mesothelioma का marker कौन सा है? Mesothelioma का new marker आया है, that is calretinine. Somehow I have noticed as soon as I say ये नहीं याद रखना, like in FMG students I'm telling you ये नहीं important. Somehow this is what you will definitely remember. That's unfortunately how our human brain works. So calretinine for mesothelioma. ठीक है, this is also done. Moving on to the next, you have to identify one more set of disease. Identify the disease. Let's see how your options and mind works. There is a patient involving two organs, lung and kidney. दोनों से blood निकल रहा है. Lung में से blood is coming out in the sputum, so hemoptysis. Kidney में से blood is coming out into the urine, so that is going to be hematuria. Now all of you are gonna tell me that what should we do? Okay, you thought it is, some of you said, ma'am, maybe it's hemolytic uremic syndrome. See, uremic part of it, but you'll need more to it, right? Hemolytic uremic syndrome में hemolytic anemia तो लिखा ही नहीं, so I don't think it is hemolytic. Okay, some of you said, maybe, ma'am, it is a case of Wegener's granulomatosis. Yeah, that I agree with you कि Wegener's होता तो lung, kidney दोनों involve होगा. But granulomatosis में कुछ granuloma should have been written, or some C ANCA, P ANCA should have been written. Nothing of that sort was written. The next one you are saying good pasture. Yes, Vaginous I have discussed, so let me discuss good pastures with you. Do we discuss good pasture as 1, 2, 3, 4 syndrome? What is 1, 2, 3, 4 of good pasture syndrome? Please note, good pasture syndrome is RPGN, means in the kidney it is RPGN type 1. Which kind of hypersensitivity is it? It is hypersensitivity reaction type 2. Which is the cause of it? It is a problem. There are antibodies against which chain? Alpha 3 chain of which collagen? Type 4 collagen. Now can you see the 1, 2, 3, 4 RPGN 1, hypersensitivity 2, alpha 3 chain of type 4 collagen. What is type 4? We always learn 4 is like floor. फ्लोर की तरह साउंड करता है. फ्लोर मतलब बेसमेंट. सो बेसमेंट मेम्ब्रेन के अगेंस्ट मैम इन सिंपल वर्ड्स एंटीबॉडीज आर टारगेटिंग बेसमेंट मेम्ब्रेन. बेसमेंट मेम्ब्रेन ऑफ लंग गया, पेशेंट विल हैव ब्लड इन द स्प्यूटम. बेसमेंट मेम्ब्रेन ऑफ किडनी गया, पेशेंट विल हैव द ब्लड इन द यूरिन, दैट इज हेमेचूरिया. परफेक्ट. 1, 2, 3, 4 में से ही कोई क्वेश्चन घूम फिर के इज गोना कम. दैट इज ग्रेट. दिस इज अ क्वेश्चन दैट केम इन द recent INI set and hence I'm discussing it. This will always come to you with a history of an elevated HbA1c, something like a 10%, 9%, कुछ बहुत ही अनकंट्रोल्ड डायबिटीज लिखा होगा, एंड सम काइंड ऑफ किडनी बायोप्सी विल बी गिवन. ऑल ऑफ यू आर राइट मैम. डायबिटीज, नेफ्रोपैथी, दैट इज किमेल्स्टीन विल्सन लीजन दिया होगा, KW लीजन. वी आर टॉकिंग अबाउट डायबिटीज मेलाइटिस अफेक्टिंग द किडनी, बट दिस इज नॉट व्हाट दे आस्क यू. दे आस्क यू व्हाट इज द अदर नेम ऑफ किमेल्स्टीन विल्सन लीजन. इफ यू लुक एट दिस गाइज, दिस गोलू ओवर हियर इज किडनी में क्या होगा? ग्लोमेरुलस होगा, एंड द ग्लोमेरुलस इज शोइंग यू दीज नोड्यूल्स. सो द अदर नेम, पिंक कलर का गोलू गोलू इज बीइंग शोन, सो दैट इज नोन एज nodular glomerulosclerosis. See, the glomerulus is there, agreed. Sclerosis मतलब ये pink and it's in the form of those golus, so nodular glomerulosclerosis, very good. What is the special stain? That is pass positive. So many times even on Telegram and otherwise on YouTube I have made you solve this question, so you cannot get this wrong. Diabetes की बात करा, so I think you know that the next disease in kidney I'm going to teach you this is going to be the via loop lesions, and I think we are what, 1 hour into the session and I have finished almost more than half of what I intended to. So we are going at a good pace and I hope it's okay for you also. Now coming to via loop lesions are seen in perfect. It is seen in lupus nephritis, SLE, ठीक है. But via loop lesions are seen in which phase or class of lupus nephritis? Lupus nephritis के तो 6 classes होते हैं, class 1 to class 6. Via loop lesions are seen in 3, 4 and 5. But maximum via loop lesions are going to be seen in class 4. So if they ask you which classes show you via loop lesion, 3, 4, 5. Maximum via loop lesions are seen in 4. It is only seen in class 4. That you have to know. Now what is via loop lesion? Photo में भी थोड़ा we should know. This golu over here, as always in the kidney, will be glomerulus. If you look at the capillaries are looking a little, I'm not drawing उसके ऊपर, I'm drawing side पे. Like this is what I want to show to you. The capillaries are looking a little more thicker. उनका मैम capillary का ऐसा लग रहा है कि wire. Let's just assume that, I hope, I don't know if you can, yeah, you can see. So if this is a wire, it looks someone has made a loop out of a wire. So this is exactly how it looks like, right? This is the wire loop lesion. So capillaries में loop बन रहा है. So if you see many of them, you will be able to see that is wire loop lesion. That is what you're seeing on a light microscope. But if I ask you what are you going to see on immunofluorescence, ma'am, full house party. Full house effect means all antibodies. I will write on top of it IgG, IgA, IgM. फिर complement proteins C1, C3, all immunoglobulins come and sit in the kidney. All complement proteins come and sit in the kidney. सबका get together होता है kidney में. That is why it's a full house party. And what do you see on electron microscopy? This looks exactly like thumbprint. Forensic का thumbprint लग रहा है. So this thumbprint appearance is going to be seen in SLE on electron. So you realized on every microscope you have a different appearance. On light microscopy you have the loops. On fluorescent microscopy you have the full house, L for L, F for F. So on electron microscopy you have the thumbprint, SLE भी हो गया. Moving on to the next question which you have to know from both medicine, path, even surgery. What is the hallmark of Barrett's esophagus? ये कौन से वाले cells दिख रहे हैं? Barrett's esophagus मतलब मैम मेटाप्लेजिया हुआ होगा. We know Barrett's esophagus. Which kind of cells must be seen over here? Perfect. It is going to be goblet cells. Goblet cells तो ठीक है, goblet cells तो intestine में भी होते हैं. I am trying to figure out the goblet cells of Barrett's esophagus. They have something special inside them. How will I stain them? Yes, they have acidic mucin. For acidic mucin, what are you using? Alcian blue. That is why look at the color of these goblet cells. It is blue in color. So I think Barrett's पर तो यही question आएगा. Now my question is that is Barrett's esophagus precancerous? One PYQ जल्दी जल्दी बताते रहो. Of course it is precancerous, ma'am. Which cancer of the esophagus does it cause? squamous cell carcinoma or adenocarcinoma. ये PYQ था. It can cause adenocarcinoma of esophagus. Remember this. Moving on to the next one. If you get this kind, I mean, I've written the answer beforehand because I know आपको आता है, surgery में पढ़ा है. If I'm not mistaken, I think tomorrow is anyway your surgery one-liner session. You will read it again. So this is the classical bird beak appearance. Bird beak appearance की वजह से patient is having dysphagia, difficulty in taking liquids and all. So you know it is a case of achalasia cardia. My question is not that. My question is, tell me an infection which can cause, tell me one parasite which can cause achalasia cardia, and that is going to be Trypanosoma cruzi. Trypanosoma cruzi causing what? Causing Chagas disease. Chagas disease, which I will talk about in micro, that can cause achalasia. That would be a true surgery micro correlation. Someone asked me methylene blue भी हो सकता था पिछला वाला. See, just by looking at blue color, so it can be anything, I agree. But methylene blue, I think you're talking about new methylene blue that is used for red blood cells का reticulocytes. उसमें you will get a blood picture. Here they will give you a history of esophageal biopsy. So you will be able to figure it out. Moving on to the next question. Can you answer this? There is an intermittent episode of edema. Patient is having swelling with cerebriform appearance of the stomach. The stomach has started to look like the brain. What is this disease? The stomach has started to look like the brain. Look at this over here. If I zoom in, it's looking like a walnut. So stomach has started looking like the brain. This is the Menetrier's disease. Menetrier's disease ka patient will have lots of attacks of edema. Why would someone have edema, ma'am, when the person doesn't have protein? Basically, this disorder results in protein loss. This is a protein losing disorder. Protein goes out into the fecal sample. That is why protein nahi hoga. Patient will have edema. Why does this happen? Increase in, very good, TGF alpha. तो अब जब बता ही दिया तो I am going to ask you a question which was there in LRR also. TNF alpha, TGF alpha, TGF beta. All time confusion but all time important. TNF alpha क्या कराता है? NF alpha, no food appetite. No food appetite is how we learn it. Means whenever they will ask you which is the cytokine because of which your appetite goes down, there's a decrease, or they will say someone has fever, that person is saying कि भूख नहीं लग रही, I'm not feeling hungry. Why is he not feeling hungry? Because of increase in TNF alpha. No food appetite. Okay, TGF alpha, GA for gastric. I just now told you which gastric condition am I talking about? Menetrier's disease. And TGF beta, बहुत fibrosis means this is a PYQ. The most fibrogenic cytokine is going to be the TGF beta. So remember, NF alpha, no food appetite. TGF alpha, GA for gastric problem, Menetrier's disease. TGF beta, बहुत fibrosis, is going to be most fibrogenic. Moving on to the next one. This is a question which I have to for formality. I know you know it, but still we have to. When would you call leather bottle appearance of the stomach with signet ring cells? Let me show you some pictures. This is the classical leather bottle appearance of the stomach, which you famously know as linitis plastica. Leather bottle means that, plastic bottle can be crushed. Plastic is, you can easily crush it. Leather bottle is very, very tough, very rigid. You can't crush it. So the stomach has become very rigid like a leather bottle, means it is a cancer which has made it that tough. Now when you look at it under the microscope, you are seeing the classical signet ring cells. Ring की तरह दिखेगा. Ring मतलब, ma'am, the diamond has to be somewhere. So if this is a ring, this is the diamond on the periphery. This is the nucleus at the periphery. So if this is the cell, the diamond or the nucleus has gone to periphery. तो ये कौन सा ट्यूमर होता है स्टमक का? Perfect. Now I can see diffuse gastric cancer as the answer. यहाँ पर नहीं पूछा जाएगा. They will ask you diffuse gastric cancer is because of which genetic mutation? It is because of a down regulation of E-cadherin. There are only 2 questions on E-cadherin that come to you in the paper. If E-cadherin is getting lost or getting down regulated in the body, which stomach cancer can occur? Diffuse gastric cancer. And the same mutation, which breast cancer can occur? I hope you remember, we have studied this in our LRR, RR also. Invasive lobular carcinoma. So E-cadherin getting lost. Stomach asked diffuse gastric cancer. Breast asked invasive lobular carcinoma. Yes, perfect. Now I've got all the different ulcers on one slide. GIT के सारे ulcers and सारे polyps एक slide में खत्म कर दो. So if I ask you, there is an ileal infection with a longitudinal ulcer like this. The ulcer is, this is how the direction of the ulcer is. That is because of which infection? Typhoid. Typhoid, ma'am, tie पहनना ना. Tie is always worn bone in the neck long axis में, तो typhoid ulcer is a longitudinal ulcer. Whereas अगर पूछा transverse ulcer would mean like that is seen because of TB. Very, very good. Coming to the next, if this I've taught you in so many classes. Flask shaped ulcer, ma'am, that is amoebic ulcer. Which amoeba? Entamoeba histolytica. So in सबका cause you know. Typhoid is what? Salmonella typhi. No need to write. TB तो ma'am Mycobacterium TB we know. Amoebic you have already written flask shaped entamoeba histolytica. आगे चलते हैं. If there are serpiginous ulcers means पहले skip था, फिर धीरे धीरे it became like a snake like ulcer is seen in Crohn's disease. Can you tell me Crohn's disease is because of which antibody? It is because of ASCA antibody. ASCA antibody causes Crohn's disease. Perfect. Coming to the next, if there is a rectal disease with ulcer and pseudopolyps. Ulcer and pseudopolyp together only goes in favor of ulcerative colitis. Right now you told me that P-ANCA is the antibody that has been associated with ulcerative colitis. So सबका cause भी आपको समझ में आ गया. I think all the ulcers and the causes are in one place. Now you're going to do all the polyps in one place. So these are all the polyps of the intestine. Polyp लिखा होगा. They will ask you why has it occurred? What is the genetic problem? So start one by one and let me know. Number 1, juvenile rectal polyp. Okay, before that I missed out on a question. Can serpiginous ulcers also occur in CMV? Many of you said that yeah, right. But usually na CMV के history के साथ they will start off with their usual that HIV positive immunocompromised patient है. So that will give you a hint of an opportunistic infection and then you will come to us with CMV as an answer, which is right. All of you who answered it are on track. No fault over there. Coming back to the genetics of the polyp. Juvenile rectal polyp. Juvenile ma'am age भी बच्चे का less than 5 years होगा. Genetic का number भी less than 5. SMAD2, SMAD4, age less than 5, gene numbers are less than 5. Very, very good. Coming to the next, how can you forget Peutz-Jeghers polyp? Peutz-Jeghers polyp is someone who will be above 11 years of age. At least 11 years का तो age होगा. And after that, the genetics is also 11. That is usually STK11. You just now told me the polyp is going to, I mean, this doesn't look like a Christmas tree, but it looks somewhat like a tree. So if they say tree-like polyp in the intestine or Christmas tree-like polyp or they say arborizing polyp, कुछ भी tree से related polyp होगा, that is a Peutz-Jeghers polyp. That is okay. Coming to the next, cow den. How can you forget this 10-10 den story? Cow den syndrome किसकी वजह से होता है? That is because of P10. Remember, P10 is the name of the gene. After the P10, we have learned chromosome 10 is in the name and the name of the syndrome is cow den. Okay, and yes, this was a recent question also. Coming to this, जिसका नाम पढ़ के I've kind of my mind, brain spins a little. Benign Ruvalcaba relay syndrome. Sunte we will also, half our mind will get lost. Same thing happens in the patient also. There is intellectual disability in the patient. इसका नाम ही ऐसा है. Then patient also says that okay, my mind is going all bizarre because of this. Mental retardation होगा. This is also because of P10 mutation. Finally, Cronkhite Canada syndrome का polyp होगा, तो that is because of which mutation? This is no mutation at all, ma'am. This is the only polypoidal disorder which is non-hereditary. Means this will occur above the age of 50 years because not your father or mother have given this. This someone has had on its own. After the age of 50 years, it will manifest. So they will ask you out of all the polyps, which is the only disorder which is not to do with the genetic mutation, non-hereditary. Answer मिल गया, that is Cronkhite Canada syndrome. Polyps हो गए. Now let's talk about these two questions which have been asked a lot in the exam. दो अलग अलग questions है, एक एक करके पढ़ना. The first one says steatoria. Steatoria means the fat that is present in diarrhea, and you know this answer. Pus positive macrophages in the lamina propria. Which disease? This is how the picture looks like. P for pus, P for pink. Pink color macrophages you can see over here everywhere. Perfect. Whipple's disease I've got as the answer. Amazing. Whipple क्या होता है? Whipple एक बैक्टीरिया है मैम. It is Tropherema whipplei. That is Whipple. तो क्या बैक्टीरिया है? बैक्टीरिया तो gram positive या gram negative? It is a gram positive bacteria. Bacteria will go only to the GIT. Is it like decided कि bacteria है तो only GIT? No, it can go anywhere in the body. This can go to the brain also. This can go to the cardiac system also. This can go to the joints also. This can go to the GIT also. So they asked you in the FMGE exam, is Whipple's disease a single system disorder or a multi-system disorder? Common sense लगाना था. Bacteria है, bacteria तो blood में कहीं भी जाएगा ना बैठ के. So it is a multi-system disorder. Perfect. Look at this next question. There is a diarrhea in the patient with duodenal villus atrophy and skin disorder also. DDDD चल रहा है मैम, पेशेंट को डायरिया भी है, कहाँ पर प्रॉब्लम हो रहा है, डिओडिनम में प्रॉब्लम हो रहा है एंड स्किन में भी प्रॉब्लम हो रहा है, डर्मेटाइटिस herpetiformis. That is because of gluten sensitivity. Yes, celiac disease. Quickly tell me, I'm not writing just the short form. What are the 4 main cereals having gluten? Bro cereals. What are they? Barley, rye, oat and wheat. Yes, barley, rye, oat and wheat. These are the ones. Wheat means all the wheat. We are a nation where wheat is consumed a lot. All of that has gluten. There are some people having gluten sensitivity called celiac disease. What is DDDD? Number 1D, patient will have diarrhea. Which part of the intestine is most commonly affected? Duodenum is affected. What is the skin manifestation that can occur? Dermatitis herpetiformis. What is the treatment of dermatitis herpetiformis? That's the last D. Treatment is going to be dapsone. But I have a question. इनमें क्या relation है? ये GIT का problem, diarrhea हो रहा है, ये skin का problem, dermatitis. What is the link? The link is that gluten results in the formation of IgA type of antibodies. When IgA antibodies will go and attack the GIT, it will result in celiac disease. When it will go and attack the skin, it will result in dermatitis herpetiformis. So tell me, in dermatology you are asked, dermatitis herpetiformis is due to which antibody? It is due to the accumulation of which antibody in the skin? It is IgA antibody. Okay, now you've answered this. Dr. Tanmay says, ma'am, HLA भी पढ़ते जाएंगे. चलो, HLA भी पढ़ते जाओ. DQ2, DQ8 polymorphisms, PYQ, very famous for celiac disease. Perfectly said. Moving on to the next one. This is a slide that I've added from the previous one-liners. This was not there. Some slides which are now I've added new. What is one slide on all the important liver wala questions? What is the composition of Mallory Hyaline or Mallory Denk bodies? These are seen in lots of disorders. Alcoholic liver disease में दिखता है, non-alcoholic liver disease में भी दिखता है. What is the composition? Perfect. Yes. CK818. For those who've forgotten, CK stands for cytokeratin. अच्छा, एक twist in the question. ये तो रट्टा लगा के सब जाते हैं. Mallory Hyaline bodies are made up of CK818. They ask you what is CK. They don't write CK. They don't even write cytokeratin. They actually give you what exactly is cytokeratin. ये होता क्या है? ये हमारे cells में, this is an intermediate filament. So you will be searching for CK818 and it will not be in the options. Option में होगा Mallory Hyaline bodies are made up of intermediate filaments. That is the correct answer in that situation. Okay, then in the liver, all these overloads can also affect. Iron overload होगा तो hemochromatosis liver को affect करेगा. Copper overload होगा, Wilson disease, तो that will affect the liver. So can you tell me the genes? For hemochromatosis, it is HFE. Common sense na, hemochromatosis, iron overload. So HFE gene present on chromosome 6. Very, very good. All PYQs. जो chromosomes we are studying now, I'm not just teaching you by the way, they are truly PYQs. Coming to Wilson disease, copper overload, very good. ATP7B gene mutation, chromosome, okay, I've got 13. No one said ATP7A because ये आपने biochem में पढ़ा है. ATP7A gene mutation is Menkes disease, that is different. This is ATP7B gene mutation which is in chromosome 13. Okay, now I've got everyone's favorite topic. There's an entire lab report given. Obviously it's to do with hepatitis B. You have to tell me what is it, positive है, acute है, chronic है, recovery है, vaccine है. What exactly is this? Hepatitis B surface antigen is positive, HBe antigen is positive, and IgM type of anti-HBc antibody. Okay, someone said SEMA. Yes, exactly. Whenever we get this kind of a report, मैम हम ना 2 निमोनिक्स एग्जाम में जाके अपने साथ लेके जा रहे हैं. जब भी हेपेटाइटिस बी का रिपोर्ट आएगा, वी विल थिंक ऑफ सीमा एंड सेक्सी. दैट इज हाउ वी विल लर्न इट. सो सीमा मीन्स दैट ओके, सरफेस एंटीजन पॉजिटिव है, ई फॉर ई एंटीजन पॉजिटिव है, एंड HBC का कौन सा एंटीबॉडी? IgM. IgM always tells me acute hepatitis. This is going to be a case of acute hepatitis. Look at the variation. If I would have said surface antigen positive, E antigen positive, instead of IgM, I would have written IgG type of anti-HBC is positive, then you would have called it chronic hepatitis. Now I've got the answers, but now my question is, are these two acute and chronic hepatitis with high infectivity or low infectivity? ये दोनों patients क्या हैं? मैम, HBe antigen always tells me about infectivity. If HBe antigen is positive in someone's blood, that person is highly infective. So both of these are with high infectivity. If they would have mentioned it's सीमा sexy में सब same रहता, but they would have said HBe antigen is not positive. You would have given the same answers, but then you would have said, okay, E antigen nahi hai. This means that is low infectivity. Is that okay with everyone? Now coming to the liver tumors, can you tell me एक ही तो tumor होता है HCC? Okay, before that, which is the most common liver cancer or liver malignancy? You will say, ma'am, HCC. अभी तो आपने बोला. I hope you're not falling for the trap again. The most common liver malignancy is also METs. The most common lung malignancy was also METs. The most common liver malignancy is also METs. Always look out for metastasis. Metastasis नहीं लिखा होगा question में. Secondaries will be written. Secondaries means the same, that there is some secondary tumor that is coming to the liver. Same चीज. METs secondaries पहला आंसर. चलो लेट्स टॉक अबाउट हेपेटोसेल्युलर कार्सिनोमा. कन्वेंशनल वो तो अभी पढ़ा. अल्फा फीटोप्रोटीन इज द ट्यूमर मार्कर. बट इफ आई से हेपेटोसेल्युलर कार्सिनोमा का वैरायटी fibrolamellar, in that you will say it is not alpha fetoprotein. Now the tumor marker is what? Neurotensin. For NEET PG students, this is a very commonly asked question. For FMGE, I feel HCC is a topic जो अभी तक explore हुआ नहीं है. They have gone into every topic of NEET PG. This is still remaining untouched in the FMGE exam. तो अगर थोड़ा सा tougher level जाना हुआ, this is what they would touch upon. Something to do with liver cancers. कन्वेंशनल HCC लिखा हुआ तो अल्फा फीटोप्रोटीन. फाइब्रोलैमेलर HCC लिखा हुआ तो ट्यूमर मार्कर इज न्यूरोटेंसिन. परफेक्ट. मूविंग ऑन टू द नेक्स्ट सेट. आई हैव गॉट अ मैराथन ऑफ 4-5 images which will take care of all the brain tumors for you, after which we will have a quick discussion of all the anemias also. Let's start. Identify the brain tumor. As soon as I say CCC means there is a छोटा सा child and there is a lesion in the cerebellum and that lesion is cystic like you see over here. What are you thinking of? Juvenile pilocytic astrocytoma. Juvenile because I said it's occurring in children. Perfect. Did we study today एक P था papillary carcinoma thyroid और एक P था pilocytic astrocytoma. उसका mutation we have already studied, that is the BRAF mutation पढ़ चुके हैं. Now what are these pink fibers that you see in pilocytic astrocytoma? ये इतने सारे pink वाले, these are some fibers known as the Rosenthal fibers. That's another question. Please note, एग्जाम में जब भी CCC लिखा होगा, there is a child with a cerebellar mass cystic lesion, pilocytic. Moving on to next one. हर साल something or the other comes on this. Something to do with all animals. पूरा zoo बनेगा question में. There is a patient with a butterfly glioma. Butterfly मतलब left पे भी है, brain के right पे भी है. With serpentine necrosis. The necrosis is looking like a snake. So butterfly glioma with serpentine necrosis. All zoo वाला story. Glioblastoma. Blastoma. Grade 1, 2, 3, 4. Which grade tumor? Perfect. It's a grade 4 tumor, ma'am. Blastoma में brain का bomb blast हो जाता है. So it is a grade 4 tumor. Very, very good. Moving on to the next question. Who can get this wrong? This is a formality that I've done. कि अच्छा fried egg appearance बन रहा है brain के अंदर, and the rule of the universe is जहाँ जहाँ अंडा वहाँ chicken. So if the egg is there, then the blood vessels are also looking like wires. They are not looking like proper goal blood vessel. They are looking like thin wires. So chicken wire blood vessel, fried egg appearance with chicken wire blood vessel. Yes, the O वाला oligodendroglioma. Common sense. I think you already know this. So formality. Agla wala is also formality that I'm doing. Quick scan through before your exam kind of a thing. Identify the brain tumor. Whirling of the tumor cells with samoma bodies. Anyway, if I look at this picture over here, brain में तो tumor है ही नहीं ना. Brain तो बिल्कुल good and happy लग रहा है. Brain के ऊपर मैम the meninges are showing me this tumor. It is a meningioma, common sense, and we know that meningioma only shows you samoma bodies. Everything goes goal in meningioma. If you look at the cells are going goal, which means that they are going whirling. They are not arranged in a line. They are arranged goal. When I look at the calcium bodies, the samoma bodies are also going गोल ज़्यादा गोल बातें कौन करता है? This the boys are going to love this mnemonic. मैम गोल बातें तो women tend to do. Yes, meningioma is more commonly seen in women. Why is it more commonly seen in women? Because it is associated with a hormone that is progesterone. Yes, that is why they will usually give you 35-40-year-old female with worsening headaches. Or they will say there is a 25-year-old female who's suddenly having increased headaches during her pregnancy, because pregnancy mein progesterone must have increased. So that kind of a history will always tell you that acha meningioma, women mein zyada, women goal baate, to tumor cell also going goal, that is whirling. Calcium also going goal, samoma bodies. Don't worry girls, I have made fun of us, but I will get back to these boys, and now is their turn. So now we will learn about the rosettes, and now we will also give it back to them by making a mnemonic on them. that is, yeah, men are fake coming on the way. So we have to maintain equality here. So I gave that mnemonic first so that then I can easily say men are fake and then no one can object, right? So we have two rosettes. What do you mean by rosettes? Short question again, you know it. Rosette matlab tumor cell aisa gol 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 rose petal ki tarah tumor cells are arranged like a rosette. Ma'am, Homer writes pseudo rosette. Pseudo rosette will have something in the center. Fake people na, fake कुछ बीच में hidden होगा. True मतलब clear hearted people, that's how we learnt it. True rosette, flexnum intestina, true rosette का center is clear. So if something is hiding, that is fake. If something is clear like a clear hearted person, then that is a true rosette. So who is fake? Men are fake. Now how you cannot object because वो गोल गोल वाले mnemonic पे तो you guys were laughing a lot. So girls, now we can laugh. Men are fake कैसे याद रखेंगे? Men, all blastoma tumors. Medulloblastoma shows you Homer right pseudo rosette. Neuroblastoma shows you Homer right pseudo rosette. Retinoblastoma shows you Homer right pseudo rosette. So all blastomas are done, and one bone tumor, that is Ewing sarcoma, shows you Homer right pseudo rosette. That's how we learned. That is, men are fake. Right? Now we come to अच्छा मैम फिर true rosette किस में दिखता है? True rosette is only and only seen in retinoblastoma. So can I say that retinoblastoma में question आएगा ophthalm में, तो retinoblastoma shows you Homer right and true, both is the answer. Yes, both is the answer. So that is also clear to everyone. Okay, pseudo rosette, true rosette गलत नहीं करना. This is one of the most balanced paper होगा तो rosette पे question आएगा. Moving on to the next question. Tell me all the someone said osteosarcoma. No, osteosarcoma is not very famous. In fact, if you want to know a question on Ewing sarcoma, orthopedics में दो ही question आते हैं Ewing sarcoma के. एक तो they will ask you the mutation और they will ask you the radiology का वो onion peel. इसमें onion peel दिखता है, but that onion peel is seen on radio. It is not a pathology finding. So you see a periosteal reaction, and mutation they ask you translocation. Perfect. 1122 is asked in orthopedics, and how do you learn it? E for Ewings, E for 11, S looks like 2, so 22, 11, 22. यहाँ तक बता दिया तो finish it off ना. Tell me the genes also fusing. EWS and fly gene का fusion होता है. कैसे याद करा? EWS, Ewing sarcoma, common sense. EWS तो gene होगा ही. And Ewings, wings help you fly. So fly gene, कौन सा fusion होगा? EWS, Ewing sarcoma. Wings help you fly. Fly gene fusion is going to be seen, and that is translocation 1122. Okay, someone said pinealoblastoma, that can show you rosettes, but not something that would be asked, but it can definitely. Moving on to all the bodies. First one I'm not asking you. Negri bodies are seen in rabies. ये सबको पता है. That is a very obvious question. I want one question for NEET PG students. Negri bodies के लिए एक special stain बताओ. This I have taught you in main videos. So if you haven't gone through it in microbiology, Negri bodies के लिए Cellular stain is used. This is only important for NEET PG students. But rabies में होता है, this everyone knows. बाकी दोनों is what everyone has to tell me. Hirano bodies and Lewy bodies. Hero, ma'am, Hirano, you had told us hero को acting कराना है. Hirano bodies are made up of actin, and that is seen in Alzheimer's disease. Yes, and what about Lewy bodies? Lewy bodies are seen in Parkinson's disease. Sometimes you will see a very lengthy history which you will not be able to get an answer to, but end में एक body लिखा होगा and you will know the answer in 5 seconds. So if they say Hirano body, Alzheimer's disease, Lewy body, Parkinson's disease, Negri bodies, तो जाने दो, you know it. Coming to all the different tumor markers, little bit of gynae also is sprinkled in this session because I think gynae का इस बार INI set में question था, so something or the other in FMGE and NEET will also come. So tell me the tumor markers for all these gynae tumors. This you had already told me. For surface epithelial tumors, you've already told me, ma'am, it is CA125 that is going to be elevated. Perfect. For dysgerminoma, seminoma, this is of course all of gynae. If you've read it in gynae, truly take a skip in pathology. What is for dysgerminoma? In ovary, seminoma in testes, same चीज होता है. LDH and PLAP, very good. LDH and PLAP. Yolk sac tumor का I will not ask you. We all know alpha fetoprotein, that is common sense. Choriocarcinoma का भी you all know it is going to be beta HCG, that is again going to be common sense. इस बार के INI set में this was the question. Granulosa cell tumor का कौन सा tumor marker? It is going to be inhibin. Yes, inhibin, and one CD marker, that is CD99. If you, and for those who not seen the INI set ka recall, the final recall video that I have uploaded with the correct options and everything after talking to students, approximately I think there are 36-37 questions from path and micro combined. that is uploaded on the PrepLadder video section. So if you go to the app, first video जो display हो रहा होगा over path and micro will be the INI set recall. NEET PG students तो must have given the INI set recall, तो आपको आता है. FMG students please वो video देख के जाना. You have to know INI set recall. Okay, so tumor markers are done. Now someone was asking me something about a supravital stain, and for those who are wanting to know कितना time और रह गया, I think 30 minutes max will be done. I'll tell you I'm on slide number 51 and I have to teach you till slide number 64. So that is the amount of time you are left with. तो गिनते रहो and you know how much on the way back you are there. So tell me, supravital stain, ये photo दिया हुआ है मैम, this is supravital stain, perfect. Reticulocyte के लिए give me an example of a supravital stain. The best one is new methylene blue. Reticulocyte का normal count बताते जाओ, they will not give you this. I hope you could recall कि hemat शुरू हो चुका है. Reticulocyte is a precursor of a red blood cell. Normal count is going to be 0.5 to 2 to 2.5% तक भी चलेगा. This much of 0.5 का variation चलता है. तो 0.5 to 2% लिखा हो या 0.5 to 2.5% लिखा हो, all that is normal. Now let me ask you the basic, मोस्ट बेसिक से शुरू करते हैं. व्हाट इज द साइट ऑफ अब्जॉर्प्शन ऑफ आयरन? तो आयरन का अब्जॉर्प्शन होता है मैम डिओडिनम से. ओके, B12 का अब्जॉर्प्शन होता है फ्रॉम द टर्मिनल आइलियम एंड फोलिक एसिड का अब्जॉर्प्शन होता है फ्रॉम द जेजुनम. आई थिंक दिस मच यू नो. फॉर दीज थ्री विच ऑफ देम रिक्वायर्स इंट्रिंसिक फैक्टर फॉर इट्स अब्जॉर्प्शन? सो अगेन आई थिंक यू ऑल नो vitamin B12 says I will not get absorbed alone, I will always make a complex with intrinsic factor and then I will go and get absorbed from ileum to the ileum. Perfect. ये वाला question have to know. Who is the master regulator of iron metabolism? It is going to be hepcidin. My question to you is, पहले तो let me ask you in a tough English language, is hepcidin a positive regulator of iron or a negative regulator of iron? Master regulator तो है, but कैसा? Positive regulator या negative? Positive regulator will mean that it will increase iron absorption. You will eat iron, it will increase your absorption. Negative regulator will mean that it will decrease the iron absorption. So ma'am, hepcidin is a negative regulator of iron, which means I will now write it. अगर हेप्सिडिन ऐसे लिखा, it is inversely related to iron, ऐसा लिख लेते हैं, which means let's assume that there is too much of hepcidin being released in your body, that will not let iron get absorbed. On the other hand, if you want कि बहुत ज़्यादा iron absorb हो, मैम मेरा तो बहुत deficiency चल रहा है, बहुत ज़्यादा iron absorption I need, then you will have to lower the hepcidin. So they work ulta. Please keep that in mind. It's a negative regulator. Okay, next hemat question. Gisapit, I have to teach you. Bone marrow aspirate needles, you know it, but I have to teach you. So what is this? These two bone marrow aspirate needles, मैम, how do you identify? तो side पे screw है या longitudinal screw है? अगर side पे screw है, that is the Salha's needle. Sorry for being repetitive, but it's important and we don't have an option. Versus अगर longitudinal screw है, तो what is it? It is going to be Klima needle. You cannot mess up on this. It is very, very important. These are bone marrow aspirate needles. Moving on to the next. One last time. You've done this in LRR. One last time you have to fill in this entire table over here. These are the three main anemias: iron deficiency, anemia of chronic disease and sideroblastic. ये पूरा iron profile. Let's start one by one. Iron deficiency anemia में, not even asking, iron deficiency है तो iron levels are going to be down only. Will there be anyone to roam around with transferrin? No one, ma'am. Traveling iron also is down. Transferrin saturation is down. Is there any storage bank account of iron? Means ferritin? No, nothing. No iron anywhere. No transport iron, no storage iron. What is the total iron binding capacity? The capacity of the body is very high. The body is very hungry. क्या रे कहीं भी iron नहीं है. I need a lot of iron. So everything is decreased and TIBC is increased with iron deficiency anemia. Compare it with sideroblastic. Sidro मतलब iron blastic, iron का blast हो गया, बहुत ज़्यादा iron, too much of iron. That means when iron is too much, transferrin saturation will also increase. There will be too much of travel iron, then there will be too much of storage iron also. This means the body's hunger will automatically go down. Can I say they are opposites? Iron deficiency anemia is the true poor situation, beggar, true beggar, and sideroblastic is true Ambani situation. क्यों? So much of iron everywhere. And then comes the most important, anemia of chronic disease. I've always told you, कौन सा chronic disease बताते हैं exam में? हमेशा there is a 45-year-old female with rheumatoid arthritis. That's their favorite chronic disease. Whenever there is a chronic disease, there is increase of an interleukin. हमेशा वही interleukin, that is interleukin 6. And interleukin 6 is now going to go and increase the hepcidin. Okay, ma'am, you had said hepcidin is negative regulator of iron. अगर hepcidin बढ़ा what will happen to iron? Iron levels will go down. Will there be anyone to travel in the with the iron? No, travel iron also gone down. कहाँ गया iron? एकदम से गायब कहाँ से हो गया? All the iron has been trapped in the bank account. All the iron has been told वहीं पे रहो, bank account में छुप के रहो. You can't get used by the body. So if the body knows that अच्छा bank account में तो iron है ना, will the body be hungry for any kind of iron? No. If you know that you have like let's say 1 CR in your bank, would you be worried at all about money in life? At the back of your mind, not at all. Your overall hunger in life will go down hopefully. So your total iron binding capacity decrease. So I have learned that anemia of chronic disease, many of you were saying this is our code language, pseudo beggar. Pseudo beggar is aajkal ka beggars that you see on the red light who are trying to show you that array we don't have money at all, but look at their bank account, look at the money in their house, they are richer than doctors, they truly have a lot of money. So why will they have the hunger of running after NB for knowing NEET PG dates and knowing about FMGE internships etc? उनका life में क्यों hunger होगा? उनके तो बैंक में already बहुत पैसे. So they are good to go. So remember, anemia of chronic disease is the pseudo beggar. One question of this is certainly gonna come in the exam, you know that. Moving on to the next, neurological symptoms. कौन से anemia में होता है? That neurological symptom is severe acute or subacute combined degeneration. Subacute combined degeneration, B12 deficiency मतलब megaloblastic anemia में होता है. Similarly this photo comes, knuckle hyperpigmentation कौन से deficiency में होता है? Same B12 deficiency में होता है. तो होता किसको है B12 deficiency? People who are pure vegetarian or vegan, because you know B12 is present more in meat, it is present more in non-veg. So non-vegetarians को तो naturally diet में they get B12. Pure vegetarian people who don't even have eggs, who don't have non-veg, and vegan people are those who don't even have milk products. तो उनको तो they don't get any B12 at all. So those are the kind of people who are going to have B12 deficiency. This knuckle pigmentation वाला photo is their favorite. Moving on to a very long list, but very very important. RBC का normal shape क्या है? Biconcave. We draw it like this, but it's not like this. Normally RBC is like this, biconcave. Why is RBC biconcave? Can you let me know? Yes, why is it biconcave? Who maintains the shape? Shape of the RBC is maintained by spectrin protein. Remember this question. हम disease पढ़ते हैं, normal भूल जाते हैं. Normal shape, biconcave. Who maintains it? It is spectrin. But if I ask you, hereditary spherocytosis, तो we know RBC becomes goal spherical. What is the most common mutation in hereditary spherocytosis? Answer is ankyrin. What is hereditary spherocytosis? It is autosomal dominant disorder, ma'am. We know that. Rarely it can be sometimes autosomal recessive. मतलब autosomal recessive will be a very rare and a very severe form. अगर हो गया it is very severe. That severe form will be because of spectrin mutation. एक बार दोबारा सुन लो. Normal shape is because of what? Spectrin. And severe form of hereditary spherocytosis is because of spectrin mutation. But otherwise, if they don't write severe, they just ask you a simple one-liner, which is the most common mutation in hereditary spherocytosis? Answer is ankyrin. Coming to the next, what is the screening test for hereditary spherocytosis? I think we all know osmotic fragility testing, जो आजकल होता नहीं है, बस examiner wants to ask. So when I say osmotic fragility, fragile, are RBCs more fragile or less fragile? Fragile मतलब weak. You tell me. Hereditary, ये छोटा सा cell, is it more fragile? Yes, hereditary spherocytosis has increased osmotic fragility. Hereditary spherocytosis has high osmotic fragility, whereas thalassemia cells have low osmotic fragility. Low fragility मतलब they are less weak. Less weak basically means they are very very tough. So can I learn thalassemia cells are very very tough, they have low fragility. Hereditary spherocytosis has high fragility. But ये तो मैम बहुत ही ना वेग सा टेस्ट है. आजकल we have one classic test for hereditary spherocytosis, diagnostic confirmatory test, वो नहीं भूल के जाना. That is what? EMA testing. What is EMA? EMA एक stain का नाम है. The name of the stain is eosin 5 malamide test. So you will say मैम ये तो stain है ना, stain तो लगा दिया. This is RBC. RBC के ऊपर आपने EMA color लगा दिया. But how do you look at it? Do you look at it under the microscope? Let me ask you. This is only for NEET PG students. ये EMA stain you have put on the RBCs. Now where do you look at it? Under microscope? In a machine? On a flow cytometer? Where are you going to view it? You are going to see it on flow cytometry. ये microscope में नहीं देखने वाला stain है. This is not that kind of pink blue stain that I'm talking about. This is a test which is done on flow cytometry. This is important for NEET PG students. Okay, now the the question that is the most recent update. What is the mutation in sickle cell anemia? What baby questions are you asking us, ma'am? ये तो हम कब से पढ़ रहे हैं, हमें पता है और हमने हमेशा पढ़ा था that at the beta 6 position in sickle cell anemia, glutamic acid will go and valine is going to be welcome. But up the change is that it is no longer beta 6 position. As per the update, now it says it is at beta 7 position. That is why I got you this baby question, because it is no longer a baby question. It is now a very, very important update. That it's not that suddenly, ma'am, kya itne saalon se were we reading wrong? We thought the mutation was at beta 6 position, and now the scientists are saying it was not at beta 6 position. It is still. See, जब DNA को देखते हो, the position is the same. Their way of numbering has changed. So now, as per the numbering protocol, they call that it's the same place. Mutation तो वहीं पर हो रहा है जहाँ पहले था. Now they just started calling it beta 7. So the numbering and terminology has changed. So now you will mark beta 7. You will not mark beta 6 in the exam. Okay, baby बड़ा हो गया. Very good. Yes, Dr. Anjali, you are right. Baby question decided to trick you guys. Moving on to the next. Sickle cell anemia में कैसा सेल दिखेगा? सिकल सेल दिखेगा मैम. अगर सिकल सेल दिख रहा है, वेरी गुड. बट अगर सेल सेज के नहीं, मैं तो दिखूंगा ही नहीं, आई विल हाइड, आई विल लुक लाइक दिस. यू विल हैव टू मेक मी into a sickle cell. How should I make it into a sickle cell? I will add some chemical. Which chemical is added? That is known as the 2% sodium metabisulfite. Another PYQ जो कोई पढ़ के नहीं जाता for some reason, I don't know why. If you think clinically patient को family history भी है, sickle cell anemia है, but cells are looking like this, that is because sickle cell anemia will only show when there is deficiency of oxygen, when there is a case of hypoxia. तो मैम अब hypoxia कैसे create करें उसको? How should we put him in a hypoxic condition? क्या करेंगे? उसका गला थोड़ी दबाएंगे. तो what will you do? You are going to take blood from him and you are now going to add 2% sodium metabisulfite. 2% सोडियम मेटाबाइसल्फाइड क्या करता है? ऑक्सीजन, पूरा ऑक्सीजन एक्सट्रैक्ट कर लेगा. इट विल रिमूव ऑल द ऑक्सीजन, इट विल पुट दैट ब्लड इनटू अ हाइपोक्सिक स्टेट, एंड सडनली यू विल सी दैट द सेल्स हैव बिकम सिकल सेल्स. सो सोडियम मेटाबाइसल्फाइड, डोंट मेस अप ऑन दिस. कमिंग ऑन टू द नेक्स्ट, एवरीथिंग अबाउट थैलेसीमियाज. व्हाट इज द जेनेटिक ऑल्टरेशन इन बीटा थैलेसीमिया? क्या होता है? डिलीशन होता है, म्यूटेशन होता है, डुप्लीकेशन होता है, इन्वर्जन होता है. सो बीटा थैलेसीमिया एंड अल्फा थैलेसीमिया दो ही तो होते हैं, राइट? Alpha, A for A, genes are going to be absent. Genes are going to be absent. Beta is badalna. Badalna would mean, ma'am, something to do with mutation. So if you ask me, beta thalassemia occurs due to what? It occurs due to mutation. Which kind of mutation? It occurs due to, many of you said deletion. I hope you said deletion for alpha. Beta matlab badalna. So beta thalassemia is because of badalna, mutation. Splicing mutation is common. Alpha thalassemia means absent gene. Absent matlab that is going to occur due to deletion. Please don't mess up. Now let me talk about this alpha thalassemia first. क्यों alpha thalassemia में मैम जो डिलीशन होगा, sometimes that can result in golf ball inclusions. How many alpha genes have been deleted that sorry for the error, golf ball inclusions will occur after how many alpha gene deletions? 3 alpha genes. So normally you and I, अगर हम अपना देखें, you and I, we have 4 alpha genes. How many alpha genes do we have? 4 alpha genes. एक डिलीट हो गया, कोई बात नहीं, 3 है, we will survive. 2 डिलीट हो गए, not a problem. When 3 get deleted, that is when it is known as the HBH disease, and this is going to show you the golf ball inclusions that I am talking about. Whereas अगर चारों delete हो गए, if there are 4 alpha genes and all 4 alpha genes get deleted, ma'am, this person will not survive. Forget survival, this person will never be born. This is going to be intrauterine death, and this is known as HB Barts. How I have learned it is HB Barts is going to be barbad fetus. Very, very brutal way of saying it, but yeah, barbad fetus means that the fetus will die in utero only, na? It's going to be an intrauterine death. So HB Barts is barbad fetus because all genes got deleted. But when 3 genes, alpha genes will get deleted, it is HBH disease, which will show you golf ball inclusions. Alpha thalassemia हो गया. Alpha मतलब absent gene, deletion की बात हो रही है. Beta मतलब बदलना, that is because of mutation. So now tell me, for beta thalassemia we do Menzer index. What is Menzer index? Menzer index, मैम, एक ही तो पूरे I think pathology में 1 or 2 numericals I teach you. This is one of them. Menzer index is M by R, means MCV divided by RBC. That is Menzer index. If it comes out to be less than 13, you will be thinking of, remember we used to learn it as thalassemia, less than 13. And if it comes out to be more than 13, you will think of iron deficiency anemia. That is also so easy for us. Settled, right? No problem over here. Moving on to the next. CD55 and 59 59 टेस्टिंग, मतलब CD55 नॉट देयर, 59 नॉट देयर, ये कौन से अनीमिया के लिए होता है? PNH, पेरोक्सिस्मल नॉक्टर्नल हीमोग्लोबिनूरिया. So for that I remember that we used to do some tests. You will have to tell me what is the name of that test. Diagnostic test, ma'am. एक तो we can do a flow cytometry because flow cytometry will tell me CD markers, तो flow cytometry tells us. There is a recent test which is known as the flare test, जो better कहा जा रहा है. So two tests are done for PNH. One is, and PNH I didn't ask you, paroxysmal nocturnal hemoglobinuria. Nocturnal, during the night patient will wake up and say hemoglobinuria, I am passing red color urine. So they will give you two urine samples. एक urine sample पे लिखा होगा 2 AM in the night, एक urine sample पे लिखा होगा 2 PM. So one of the urine samples will be red, the night वाला urine sample is red, the day वाला urine sample is normal yellowish color. So you will be like, अच्छा this is PNH, CD55 59 का problem. Flow cytometry flare करेंगे. And what is the drug of choice that you usually give for PNH if asked in pharma or asked in medicine? Eculizumab is the recent drug of choice that is being given for PNH. Perfect. Now coming on to one last thing कि इसमें ये सब cell same दिखाई देते हैं. So let me ask you, what is this cell number 1? It looks someone came and decided to bite the cell. Someone came and decided to bite the cell. तो इस RBC को bite करा. तो मैम this must be the bite cell. Okay. Coming to the next one, ये तो कोई नहीं गलत करेगा. Sickle दिख रहा है साफ साफ. These are all sickle. ये तो sickle cell anemia होगा मैम, कोई doubt ही नहीं है. Coming to this one, what is this? The cell is looking like a tear. It's crying. Teardrop cell. ये तीनों हमने identify कर लिए. See over here also. It's crying. Tear जैसा बन रहा है. तो अब इनका तीनों का जो नाम है is with D. Now you have to tell me which D is bite cell, which is sickle cell, and which is teardrop cell. Common sense, tear sounds like dacro ना, तो dacro must be teardrop. Common sense, ma'am. Dacroadenitis, lacrimal glands के लिए बोलते हैं. तो teardrop is dacro, and that is formed because of myelofibrosis. Myelo का मतलब होता है bone marrow. Bone marrow में there is fibrosis, myelofibrosis. तो how will RBC come out? Poor RBC. While coming out, पूरा fibrous cage था. RBC में निकलते time RBC said, अरे my shape got changed. I am now looking like a teardrop. So myelofibrosis में दिखेगा. Okay, what is drepanocyte? Drepanocyte is sickle cell. That is seen in sickle cell anemia. And what is degmacyte? Degmacyte is bite cell. I have learnt it as dog bite. Dog bite, so that the D's don't get confused. Dog bite, degmacyte, bite cell is seen in G6PD deficiency. तो सब तो पढ़ लिया. Number 1, if I study degma, dog bite से याद रहेगा. If I study dacro is tear. So the only thing I have to study is drepano is sickle cell. So the D's are settled for us. Now moving on to your favorite topic, which is gonna trouble you, but never mind. There is a child, you have to guess the leukemia. As I said, your favorite topic. You have to guess the leukemia where there is a child. पहले तो child पे मैम हम वैसे ना हमेशा ALL बनाते हैं. Child का leukemia हमारे लिए ALL होता है. How many of you are guilty of doing this? It's a good trick, but थोड़ा सा और पढ़ना एग्जाम में. Don't be so overconfident. When I talk about child, I am thinking of ALL. But ALL is acute leukemia. For acute leukemia, the blast count should be more than 20%. Correct, fit हो रहा है. Acute lymphoblastic leukemia. Lymphoblast का what is the special stain? Lymphoblast का special stain is PAS. So this is a classical case of ALL. Agreed. Now there is an adult with more than 20% blast. More than 20% blast, acute leukemia. Or rods, मतलब myeloblast. So this becomes a case of AML. बेसिक आई एम आस्किंग यू. यहाँ तक नहीं आएगा. अब इसका अगला क्वेश्चन आएगा. देर इज एन अडल्ट विथ सम बैड लुकिंग सेल्स शोइंग क्रिस क्रॉस अपीयरेंस. समवन आस्क्ड मी हाउ मेनी स्लाइड्स लेफ्ट. ओ वी आर ऑन 60th. तो आई थिंक 4-5 लेफ्ट. बस बहुत जल्दी खत्म होने वाला है. एज आई सेड, आई थिंक बाय 7 एज प्रिडिक्टेड वी आर ओवर. ओके, विद क्रिस क्रॉस मतलब देर इज अ सेल एंड देन द और रॉड्स आर शोइंग दिस काइंड ऑफ अ क्रिस क्रॉस. व्हाट आर दिस? दिस इज AML-M3. very very good. AML-M3. this is also the only leukemia where the patient can die because of DIC. The only leukemia to have DIC. AML-M3. the only leukemia where chemotherapy नहीं देना patient को. Treatment cancer का यहाँ पर is not chemotherapy. What is the treatment that you give? We give all trans retinoic acid and arsenic trioxide. We give, I've written all short forms. All trans retinoic acid मतलब vitamin A metabolite. All trans retinoic acid and arsenic trioxide देना. Please don't give chemotherapy. All fancy questions are here. Which is the leukemia with crisscross or rods, AMLM3? Which is the leukemia with DIC, AMLM3? Which is the leukemia where chemo is not given, something else is given, AMLM3? Which is the leukemia not associated with radiation? मतलब radiation से तो हर cancer होता है मैम. Which is the cancer which is not going to occur because of radiation is going to be CLL. तो CLL को, CLL is also known as what appearance? It is known as convent schoolgirl appearance. Why is CLL called as convent schoolgirl appearance? Because ma'am, lymphocyte ऐसा लगता है everyone is wearing a uniform like a convent schoolgirls. Everyone is looking the same because they are all lymphocyte. Sub, no neutrophil, no other cell, bus lymphocyte. So now CLL is associated with two syndromes. नीट पीजी के लिए इंपॉर्टेंट, एफएमजी थोड़ा सा लेवल अप अगर हुआ जो कि हिमैट में हो रहा है, दिस इज व्हाट दे विल टच अपॉन. CLL में दो सिंड्रोम्स हो सकते हैं, ईवैन सिंड्रोम एंड रिक्टर सिंड्रोम. व्हेन आई टॉक अबाउट ईवैन सिंड्रोम, इट साउंड्स लाइक ईवैन एवरीवन. एवरीवन कौन कौन है? RBC, WBC एंड प्लेटलेट. एवरीवन विल गेट अफेक्टेड. WBC तो पढ़ ही रहे हैं मैम. CLL, RBC में autoimmune hemolytic anemia and platelet में ITP. When all three things occur together, E1, everyone, E1 syndrome. So AIHA plus CLL plus ITP, EVANs. What is the next one? Richters. I read it as Richter. Rich क्या होता है? Typical Bollywood movie के छोटा आदमी becomes बड़ा आदमी. That is rich बनना. So छोटा आदमी is what? CLL is also known as small lymphoma. Small cells वाला lymphoma. When the small cells wala lymphoma becomes diffuse large lymphoma, small lymphoma becomes large, chota admi becomes bada admi. So small lymphoma becomes large lymphoma. He's become rich, made it in life. So Richter's syndrome. I have one question of micro medicine, whatever you want to say. If I ask you कि brain में rich focus किसे कहते हैं? When do we say that there is something called totally off track? बस सुनने में same है. Rich focus made in the brain. What is this, guys? कौन सा infection? When I say in the brain there is a Rick's focus, the exact name is Rick's focus. TB का focus जब brain में होता है मैम, that is known as Rick's focus. So these rich things I've put in one place. Anyway, coming back, CLL में everyone was wearing the same uniform, so that was convent school girl appearance. CML में everyone is wearing different pretty clothes, that is college girl appearance. Or you can say some party is happening, everyone is dressed beautifully, so garden party appearance. CML में lab score is going to be low. That's a favorite question. NEET PG students, normal lab क्या है? Staining है. Normal lab score कितना होता है? For NEET PG students at least you should know 40 to 100. For everyone else just know कि ये score कम हो जाता है, less than 40. Low lab score is seen in CML. Okay, the next one that you will tell me, if I ask you this kind of a question, guess the lymphoma now. रीड स्टर्नबर्ग सेल हमने पढ़ा मैम, तो हॉजकिन लिम्फोमा तो समझ आ गया. बट द एग्जामिनर विल आस्क यू क्लासिकल हॉजकिन या नॉन क्लासिकल हॉजकिन, वो वाला क्वेश्चन आपसे पूछा जाएगा. सो लेट अस स्टार्ट. व्हेन आई से CD15 and 30 पॉजिटिव, दैट इज डेफिनेटली अ क्लासिकल हॉजकिन्स लिम्फोमा. लाइक इट कुड बी मिक्स सेल्युलैरिटी दैट यू सी इन इंडिया. बट व्हेन द टिपिकल मार्कर्स आर नॉट देयर, not CD15 30 positive, if they give things like 20 and 45 positive, that is the non-classical Hodgkin's lymphoma. Can you tell me, classical वाले में तो मैम mostly we see that owl eye वाला, usually owl eye appearance. Non-classical में कौन सा वाला रीड स्टर्नबर्ग सेल दिखता है? It looks something like a popcorn, so that is also known as the popcorn RS cell. Repeating, the classical Hodgkin's lymphoma, classical RS cell is 15-30 positive, whereas the non-classical one, which is popcorn RS cell, is 20 and 45 positive. Which lymphoma has starry sky appearance? I mean, I don't even feel like asking you. It is Burkitt's lymphoma. Burkitt's lymphoma में हमेशा history होगा of an African child with a jaw swelling. Why African child ही हमेशा बोला जाता है? Because Africa में which virus is endemic? Epstein-Barr virus. So Epstein-Barr virus indirectly causes Burkitt's lymphoma. That is why they always give an African child. EBV is endemic over there. Coming to next, Potrier's microabscess कौन सा lymphoma? मैम abscess तो infection में बनता है, and you are talking about cancer. That's the misnomer. Potrier's microabscess is seen in, look at this, very good guys, mycosis fungoides. Please note, mycosis and fungoides both sound like fungal infection. That is why they named it abscess. Is this a fungal infection? No, it is a misnomer. This is the other name of cutaneous T non-Hodgkin's lymphoma. Means it is a lymphoma and it is occurring in the skin. That is Potrier's microabscess. अच्छा, अपने आप you have started answering कि अच्छा इसके बाद ना मैम you will ask us what is Munro's microabscess. आपका हमेशा वही क्वेश्चन रहता है, तो हम पहले बता देते हैं. Munro's microabscess is going to be seen seen in psoriasis? That's another very important question. You have that mnemonic PMPM. If I ask P, you will answer M. If I ask M, you will answer P. So हमेशा PMPM का combo, which means if I ask P, Potterius microabscess, your name of the disease has to start with M. That is mycosis fungoides. If I ask M, that is Munro's microabscess किस में दिखता है, so your name of the disease will start with P, that it is going to be seen in psoriasis. So that is how we learn it. Perfect. Now I have another question over here, which is you have to know the blood bank का temperatures common. You have to know them. तो blood bank में तीन तो चीजें होती हैं, either something to do with red blood cells, blood, whole blood, or to do with platelet known as PRP, that is platelet rich plasma, or to know with fresh frozen plasma. Easiest से start करते हैं मैम, fresh frozen, इसको तो frozen रखना पड़ेगा. अच्छा, you guys have started उल्टा, ठीक है, I'll go with you. You started with red blood cell already, ठीक है. Red blood cell is going to be kept in the refrigerator, ठीक है. Refrigerator में रखना है तो 2 to 6 degree होता है ना refrigerator का temperature. Okay. Now when I talk about platelet, platelet is kept at a very high temperature, 20 to 24 degrees, no, almost reaching room temperature वाले cabinet में रखते हैं इसको. And platelets have to be moved continuously. Never ever stop this line. Continuous agitation is a must. Machine is always rocking left and right. Continuous agitation. And fresh frozen, anything less than -18 चलेगा. Exam में -18, -20, -22, कुछ भी -18 से कम का लिखा है चलेगा. That you can mark in the exam. That was the temperatures. What about the shelf life? Now frozen वाले का तो shelf life, like frozen food is also kept for 4, 6, 8 months. So frozen blood is also kept for 1 year. Common sense. Anything that you are keeping very at a high temperature, उसमें तो risk है ना मैम, bacteria can grow at that temperature, so I can't store it for very long. Platelets I can only store for 5 days because after that I have a risk, maybe bacteria grow कर जाएगा, then I can't give that blood to anyone else. Okay, what about red blood cells? Red blood cells का shelf life will depend on the anticoagulant that has been used, and that is another good thing. I think I'm just left with one more slide after this, so we are good on track. So बता ही दो फिर. Anticoagulant कौन सा मैम? There are 3 anticoagulants that you can use. One is ACD, one is CPD, one is CPD and A, and one is CP-SAGM. ये 4 एंटीकोएगुलेंट है. डिपेंडिंग ऑन बैग में कौन सा एंटीकोएगुलेंट है, द शेल्फ लाइफ ऑफ द रेड ब्लड सेल विल बी डिसाइडेड. इफ आई हैव यूज्ड ACD 3 अल्फाबेट्स तो 3 वीक्स तक रखना. इफ यू हैव यूज्ड CPD 3 अल्फाबेट्स तो भी 3 वीक्स तक रखना. If you have used CPD and A, you have to count the characters, 5 characters, so 5 weeks तक shelf life. And if you have used CP-SAGM 6 characters, so then it is going to be 6 weeks का shelf life. They will not write in the exam as weeks. Weeks is your mnemonic. They will write days. So ACD 21 days, CPD 21 days, CPD and A 35 days, CP-SAGM 42 days. That is how they write. आपने याद करा as weeks, answer will come in days. इतना मैथ्स तो कर लोगे. Anyway, coming back, the temperatures are done. The last question for the day is match the following for you. I've written a list of tests over here. I've written a list of vacuotenors over here. You have to tell me the answer. Dr. Muskan before says that ma'am, multi-donor platelet is better or single donor? Single donor is better. Reason being that you are receiving blood from a single person, which means that the chances of reactions would be less. So of course single donor. Coming back, chalo. I'll just take up doubts. Last slide. इसके बाद सारे doubts कर लेंगे. LFT, KFT hormones, ma'am, these are the things in which you require serum. If you require serum, this means the blood should clot ना. Blood को पहले clot कराओ, and then the serum is going to come out. So you need that vacuotenor which has no anticoagulant. क्यों? Because you want blood को clot होने दो. So that is going to be done either in a red vacuotenor or it is going to be done in a yellow vacuotenor because they don't have any anticoagulant. There is no anticoagulant in this. तो मैम blood तो clot करेगा, कितने टाइम में करेगा? इसके अंदर the clot red वाले में the clot is going to form within 60 minutes and yellow वाले में the clot is going to form within 30 minutes. So we always used to joke that अगर तो ऑर्थो से सैंपल आया है या सर्जरी से आया है, who are a little chilled out, then you can collect it in a red vacuotenor because they will wait for 60 minutes कि blood clot होगा, then the serum will come out and then we will do the test. But if the sample is coming from the gynae department, this was just a joke that we had during internship, that if it's coming from gynae department तो please yellow vacuotenor में लेके आना because they are not gonna wait for 60 minutes and they'll keep calling our lab. So then we used to tell them get it in the yellow vacuotenor because blood will clot jaldi within 30 minutes, the serum will come out and then we will be able to give them the report faster and they won't shout on the phone on us because shouting in the gynae ward and OT is a very common thing. Anyway, coming back to CBC. What is CBC? see any kind of complete blood count is going to be done where? It is going to be done in the purple vacutainer, that is going to be EDTA. Perfect. Coming to any kind of sugar, fasting blood sugar, postprandial blood sugar, random blood sugar, any kind of sugar will go in this gray vacutainer. Gray vacutainer में सबसे ज़्यादा twist and turn आता है. Gray vacutainer में if they ask you what is the anticoagulant, it is potassium oxalate. If they ask you what is the additive, it is sodium fluoride. Please note, they will say, acha, what is going to stop the clotting of the blood? Anticoagulant, potassium oxalate. What is the additive that you've added? That is sodium fluoride. Every sugar, every glucose goes in gray, but glycated hemoglobin, इसमें you are looking at glycated plus hemoglobin. Ma'am, that cannot go in gray, that is going to go in purple. Sorry, this is kind of messed up. I will do it properly before sending you the final PDF. So please note, all glucose go in gray, but glycated hemoglobin is going to go in the typical purple vacutainer. Coming to the next, arterial blood gas analysis, ABG, that has to be going in the hara vacutainer. Hara means the one with heparin, hara vacutainer heparin. Lastly, coagulation profile, jo bacha, ma'am, coagulation profile like PTINR, that is going to be sent in light blue, that is trisodium citrate. I mean, image based questions have come so many times. I just feel aajkal na match the following zyada aa raha hai. So this was just a take on match the following if this has to come from vacutainer point of view. Otherwise, I have taught you vacutainers in LRR, तो वो तो detail रहेगा. This was just for your revision. And of course, I will make a better match the following of this before sending it to you, which certainly brings us to the end of this session. And from my side, pathology one-liners are done. I think we finished exactly in 2 hours, and I'm very happy because this was the plan. And after this, of course, I'll be meeting you again on June 5th, where at 5 o'clock again we will have a 2-hour session that will be for microbiology, and we will have your favorite subject, 100 one-liners for that as well. Okay, for ABG, green or syringe? Vacutainer पूछा तो green, but practically, Dr. Amit, what we are using is a syringe. Heparinized syringes are used for arterial blood gas analysis. Okay, thank you guys. Thank you so much for being so patient and so responsive, giving such great answers, which is really difficult when you have an exam because of the pressure, but I think you guys have done really well. Yeah, STK 11 पे क्या question है? CML and PNH में low lab score है. You are right. You are perfectly right on that. Dr. Samreen, I will do that as soon as the आजकल वो जो 10-10 वाला series चल रहा है उसके बाद I will get the quizzes also back. Dr. Abhijit, medulloblastoma question mark. I didn't get the question. Someone's asking me about STK11. Just write the full question so that I'll know what exactly are you guys watching out for. How to know medulloblastoma, Dr. Abhijit? Homer right pseudorosette. We had said na, men are fake, men are pseudo. So medulloblastoma में Homer right pseudorosette होगा. Plus clinically, if you're asking me, it is going to be occurring in children and in the cerebellum. Cerebellar tumor होता है with Homer right pseudorosette. Okay. Someone asked me about breast में STK. Yes, STK gene in breast was asked in the recent INI set. In 1% incidence, STK mutation can cause breast cancer. So it's a very rare thing, but yes, possible. Yes, STK11 Peutz-Jeghers, someone had written. One more thing which I forgot to mention. When I'll give this PDF to you, which will take 5 to 7 minutes for me to convert and put across, there will be 2 or 3 extra slides, like always, bonus slides. उसमें कुछ photos होंगी of renal pathology, which I feel that no matter which session of patho you are doing, वो photo हर बार देखना. I've taught you in LRR, but I've just added them again over here because I want you to revise it once on your own. So in that you will be able to, revise it. And if you need any help, LRR video में वो सब पढ़ा हुआ है. But I've just given it to you once more so that you can revise it on your own. Okay, Dr. Monimala, yes, totally. The old days, live sessions are always fun with students because there is so much that I also get to learn, and it's more interesting for me than to record because then you're teaching a blank wall. Here at least I know whether you guys are understanding or not, so that's so much better. So yes, okay, so I'm just reading through questions. Conduct LRR separately? No, Dr. Medico, wo jo LRR tha na, that is very good to go for FMG. Trust me that there is no separate FMGE LRR that is required. That is particularly good to go. Usme sare PYQs were settled. So don't overload yourself with too many sessions. That is good enough. GT score is not improving. Every time I have the same answer, and it works for every student. Whenever you give a grand test, if you haven't given one seriously, sit down without distractions, give a grand test true to your heart. You should know that इसको मैंने बिल्कुल exam day जैसा दिया था, without any phone or any distraction or break. Now in that, analyze the bottom 5 subjects, because these days every app tells you your worst performance, right? In which 5 subjects. Usually those subjects are pharma, biochem, medicine, क्योंकि bulky है तभी, otherwise medicine सबका अच्छा होता है, but it's very difficult to finish the syllabus. For some people it is also microbiology. So these 4-5 subjects which you will get at the bottom of the list, you know that okay, I have to first go through their notes once, whether it is rapid revision or LRR or whatever you are doing depending on when your exam is. उनके नोट्स 5 सब्जेक्ट्स, जो वर्स्ट 5 सब्जेक्ट्स है उनका दोबारा नोट्स पढ़ो, प्रॉपरली नोट्स पढ़ो, PYQs करो, एंड देन गिव another GT. You will automatically see your score rise up. It is always the bottom 5 that are pulling you down. If you master those bottom 5 subjects of yours, which are totally yours, no, everyone will have a different list, right? If you master those, your GT score, no one can stop from rising. It has to rise, but you have to master them, means you have to do the entire notes once again of those 5 bottom subjects, and you have to do the PYQs. PDF 5 minutes, I will have to end the session, only then I can give PDF, otherwise I can't. So 5-7 minutes max, उससे ज़्यादा नहीं लगेगा. RDW, Dr. Jagdish, in iron deficiency anemia, it increases. In iron deficiency, it increases. In thalassemia, it's the same. Dr. Raman, for electrolytes, practically, if you ask me, what am I doing in my lab? We do it in a plain red or yellow vacutainer. Exam में क्या लिख के आना है? Green vacutainer, because heparin is what is written in the books for electrolytes. But what am I doing practically every day, day in and day out, doing it in a red or a yellow vacutainer. LRR enough for revision? Yes. If you have an exam anytime, whenever you are 2 weeks away from the exam, then LRR is your mainstay. But till you don't reach that 2-week point, till that time अपना rapid revision को जब तक पकड़ के रख सकते हो, you have to. I mean, that student will always get good marks who did not give up on rapid revision till the last minute. But then comes those last 14 days जब नहीं हो सकता ना, it is humanly not possible. Then you switch to LRR solely, but not till then. Okay, PDF gang is here. Yes, I know, but PDF gang, you will have to wait. I will have to end the session for you to send the PDF, and I will give the PDF. The PrepLadder team will upload it as a link also. I will put it up on Telegram. It will be there on the app. जहाँ पर भी हो मिल जाएगा. That I can guarantee. Any other question that you have which I have missed out in this flood of doubts? The link, you know, I always keep the thread open for doubts. So this link will be open for pathology doubts, strategy related, anything else, topic related. Put it in the comments and I will get back to you. Okay. Right. Okay. Thank you so much. See you soon on June 5th with microbiology. Thank you so much, guys.